Welcome to this third installment in our series of live Saturday sessions. I'm Dave Fuhr with Grit, and I am honored to be with you. Today we have three separate sessions, each to focus on different and unique aspects of what we're going through as a community. Our first session that we'll start out with is an adolescent and young adult panel led by leaders and individuals in the AYA movement, specifically to honor this AYA Awareness Week. The AYA community helped me find my voice and get through cancer in my 20s, and I am so grateful to have them here with us and to have you join in that conversation. Our second conversation will be led by Dr. Catherine Benedict and Swamini, and it will focus on our mental health and well-being. It'll be a great conversation, and we'll have practical coping skills to help us deal with this intense moment and then everything we face as a community going forward. And our third panel is led by medical, scientific, and advocacy experts who have spent their careers at the National Institute of Health, at pharma companies developing treatments, and now on the front lines of treating the cancer community through COVID. I'm deeply honored for our partnership with the American Association for Precision Medicine to be able to bring this series together with you. These are remarkable scientists, physicians, and humans, and I am proud to have this time together. But before we get started, I'd like to take a moment to ask how you're doing. If I may, please just type in the chat box a word or two that describes how you feel today. And also, if you'd like, what state or country you're connecting from. I'll give everyone a minute. Oh, it's so nice to see my family in the chat bar. Hello to everybody too. Wow, I love calm in Columbia, South Carolina. Grateful and terrific. It's so nice to see everybody and feel you together with us. Welcome, Toronto, Canada. We encourage you to please continue chatting, typing questions, making comments throughout all sessions as we go forward today. I'd like to thank my family for getting me through cancer. I would not have gotten through the way that I did or be the man that I am without them. Thank you. I'd like to thank our team with Grit for everything that they do to support the cancer community and each other. I'd like to thank Ellis and all of our partners, spouses, family, friends, everybody who we get through this together. Our name is Grit with a Y because there is no I in Grit. It is a team sport in every way. I'd like to thank you and all of the community for joining us and for supporting each other through this and everything we face as cancer survivors, caregivers, advocates, researchers, physicians, and all kinds of people working together. And especially at this moment, I'd like to start with a pause for everyone on the front lines and everything they are doing to treat and care for the cancer community through COVID, this intense moment, and in general. If we may, let's please close our eyes and send our thoughts for them for just a moment. Thank you so much. We are deeply proud to be together, excited for these next few hours together, and I am so honored to introduce my friend and the head of Elephants and Tea to lead our next panel. Nick, please take it away.
Thanks, Dave. Morning, everybody. Happy to be here. Again, I'm Nick Galrakis, co-founder and president of Elephants and Tea. And we have an awesome AYA panel today. And why adolescent young adult? Why a panel on that today? Well, it happens to be National AYA Awareness Week. And we're kind of capping it off with this session today. So thrilled to be with three of my favorite people. First is Allyson Silverman, the Chief Executive Officer from Stupid Cancer. Jennifer Anand, an AYA survivor and a regular contributor with Elephants in Tea, and also has spoke at CancerCon, Stupid Cancer's young adult conference in the past. And Whitney Hadley, AYA support specialist and community outreach coordinator at Rainbow Babies and Children's Hospital in Cleveland, Ohio. So welcome the three of you. And before we kind of go any further, I'm going to ask all three of you to kind of say something just as a hello and maybe a little bit about yourself. So first off, Allyson, I'll put you on the spot. Go right ahead.
Thank you, Nick. Thank you, everyone, for joining us today. We've got a great panel and a lot of really interesting conversations to have throughout the day. I'm really excited to be a part of this. I am the CEO of Stupid Cancer. Our mission is to empower adolescents and young adults affected by cancer by ending isolation and building community. Through our innovative programming and communications, we aim to provide support, resources, education, and a sense of community, both online and in person. And we encourage you to come and join us, especially during this difficult time when we're shut up in our homes and our apartments, to help connect and share resources and ideas and feelings. We're really here to help you get through this.
Awesome. And I'll pass it over to Jennifer now to say a few words.
Good morning, everyone. My name is Jennifer Anand. I'm a two-time Hodgkin's lymphoma survivor. I was diagnosed at 17 and again at 18. And this March, I celebrated 7 years from a bone marrow transplant. I love the cancer community. I found it a little later in my cancer journey, but it has just been such a huge part of my life, and I've made so many incredible friends through this. And I'm so excited to share the space with you all this morning.
And Whitney, if you would, please.
Hi, everyone. I'm Whitney. As Nick said, I'm the Adolescent Young Adult Support Specialist and Community Outreach Coordinator at Rainbow Babies and Children's in Cleveland. And so what that means is I work with AYAs every day, kind of helping guide them through their cancer journey, whether they're newly diagnosed or in survivorship. So that's what I do for work. I'm also a 23-year pediatric survivor.
Thanks, Whitney. And a little bit about myself and Elephants in Tea, since I realized I didn't start off with that. Elephants in Tea, we are a nonprofit media company with the mission to help adolescent and young adult patients, survivors, and caregivers know that they're not alone in their fight with cancer. And the name Elephants in Tea, the elephant in the room is cancer, and tea is the relief that conversation can provide. And we have the only magazine, digital and print, written by the AYA cancer community, telling their own stories in their own words. You'll see all of our stories are in the first person, so people get to hear exactly what people are feeling and thinking, and especially in a time with this COVID-19 crisis that we're dealing with. And my inspiration, I am not a patient nor a survivor. My brother is my inspiration and my mom's inspiration, who's a co-founder of Elephants in Tea. Steve, when we started, was a two-time cancer survivor. He is now since the fall, three-time cancer survivor, I think is how we're classifying him, and fighting a fourth cancer as well. So it's been a interesting time. He's 29 years old, was diagnosed with his first cancer when he was 15. So it is his drive really drives us in everything that we do at Elephants in Tea and for the adolescent and young adult community. So let's get right into it. As you can see, we've covered some different bases, from a sibling and myself, from a survivor and a social worker, and Whitney, Jennifer being a survivor, writer, and of course, Allyson leading Stupid Cancer, an organization that supports adolescent and young adults. So let's talk a little bit about National AYA Week and why it is so important. I will lead off with the comment, and then I'll throw it to our three panelists here. And National AYA Week, with everything going on with the COVID-19 outbreak, there was a group of us that came together to really start a new initiative this year socially on social media to get some sharing going on and drive more awareness about the struggles that adolescent and young adults go through every day. And clearly, like everything else, a grenade was thrown into the middle of that with the outbreak of COVID-19. And we were afraid that the messaging was going to get lost in the shuffle. But ultimately, we had a conversation and realized that this is why we do AYA National Awareness Week. The big reason is 20 and 30-year-olds, they look like they're healthy, right? You take one look at Whitney and Jennifer and they go, they're both good looking, they're both good to go, they're fine. But in reality, they're at high risk, right? They have issues that are underlying that we don't see on a day-to-day basis. So we decided to, one, that was one of the dumb things people say to people with cancer, and that was the theme behind what we decided to do is, oh, you look fine, you look good, you've beaten cancer, you don't have to worry about anything else. But that community, our community, is at such high risk with what's going on with COVID-19 right now and other diseases that come about. So that was just one of the underlying things that myself, Allyson and Stupid Cancer, and many others took a big part in. And I thank all those awesome organizations for being a part of this push this year and spreading the word. And I think we did an awesome job. So, but that's what one of the big things for me in running Elephants in Tea, an organization that supports AYAs, is making sure that people understand the struggles that this group goes through that not everybody really witnesses. Allyson, I'll throw it to you first. If there's anything else you wanted to add to that, being the head of Stupid Cancer, that you saw this week that you might want to share too.
I mean, I would echo everything that you said. It was really a great opportunity to shine a light on this community and the unique challenges that this community faces. I think we saw from a lot of folks, especially going through a lot of the comments on social media, that there was this feeling of feeling ignored, especially those folks who maybe through their treatment or at the end of their treatment, that, okay, you're fine, it's time to move on, get on with your life. And even before the crisis, that was kind of a very prevalent feeling, but especially now, recognizing that there are significant challenges and fears and anxiety around being immunocompromised and being in the middle of a global pandemic. We saw a lot of dismissal from family members and the healthcare professionals when they went in with concerns about their health prior to diagnosis. And so the incredible thing about this week is that it really gives a voice to a lot of the adolescents and young adults out there, gives them an opportunity to see that they're not the only ones that are going through this. And our hope is that it sheds a light for those who aren't aware of these unique challenges that adolescents and young adults face by highlighting this through the robust social media programming that we put out. And I want to thank Nick for being such a force behind getting this off the ground, and the other groups that were involved that really made it such an incredible week.
Thank you, Allyson. So let's throw it over to Jen now. Being a survivor, what two-time survivor, right? What does National AYA Week mean to you as far as just kind of watching what's going on and even kind of giving a voice to the AYA community?
I, for one, am so thrilled that you did continue to do it this year, even with COVID and everything going on. So I think the big thing is always the awareness. So many different cancers have recognized colors and stuff, but young adults as a whole, the first thought when you're sick or something isn't cancer. And I know that was my case and many others. So I think just for the non-cancer population, making them more aware of how many people are affected by it. And one of my favorite things about this week has been the dumb stuff people say post. And I've shared that on my Instagram every single day. And it's just been crazy to see the reactions. So many other survivors oh my gosh, yes, somebody said that to me, and just sharing those stories. And then from other friends of mine, just oh my goodness, I have said this and I feel horrible. I'm going to make sure not to say this in the future. And just giving them, a better idea, was mentioned, of how much this whole pandemic affects me and why I do need to be extra careful in what I do right now.
Thanks, Jen. And Whitney, you have an interesting perspective on things with being a survivor, but also working with patients. Anything else you would add to that? I know that you probably echo what Jennifer said, but just curious your thoughts too.
Yeah, I think I definitely echo a lot of what Jennifer said, but also from the perspective of some of the patients and families that I've talked to this week specifically, who saw a lot of the AYA week stuff, and they're really happy that you went through with it and you kept pushing it forward, because the COVID-19 situation is very triggering for a lot of them. And it's a good way to help them kind of communicate some of that to friends and other family members who weren't in the thick of it, who didn't really get it. I talked to one family friend actually last night about how they feel like they are way more susceptible because the last time they were going through cleaning everything and wearing masks and having all of these drugs and medications on hand was when their loved one was sick. So I think that this kind of gives voice to a lot of what AYAs and survivors and active patients are feeling that might be a little bit different. And I think it connects people outside of this community to understand a little bit of what a small snippet of what it might be like to live that kind of a life for a while.
Thanks, Whitney. And, you know, even a question back to either three of you, if you want to chime in. When we set up the strategy behind National AYA Week with and for those that weren't aware, we shared Monday through Friday a dumb thing that people said to people with cancer. Do you feel, you three, that was a nice way? Because our biggest goal was, we all do such a wonderful job of reaching our AYA bubble, our AYA community already, but we wanted to branch it out and kind of reach those that might not be aware. And I think, Jennifer, you said it perfectly, that some friends of yours realized that, oh, wow, I said that dumb thing once. And so that to me is so good to hear that it was resonating with people that aren't necessarily inside the AYA bubble, right? So just curious, anything the three of you would add to that?
Yeah, I think, you know, looking at some of the metrics from some of the comments, Tuesday, when we were talking about side effects, was probably our most engaged day, where people, you know, kind of going back to this idea of not really seeing the full picture of an AYA and the impact of cancer on an AYA. And we saw a lot of comments about how it did kind of open people's eyes and how family and friends responded in a way that was very eye-opening and realized that, oh, side effects are a part of this process. And I thought you were done, but you're not. And, you know, thanks for kind of reminding me that this is can be a lifelong journey for some people.
That's a great point, Allison. Jennifer or Whitney, anything else either of you would add before we move on to the next question? All good. All right, cool. And I should add too, for the audience, at any point in time in the chat, feel free to raise your thoughts too. If you did see anything from this past week, love to hear it. And same with the rest of the questions that we have for the panel here today. We'd love to get your feedback as well. We like to interact with people. That's part of the fun of this. So next question, given the worldwide pandemic, the global pandemic that we're going through, there's been an overload of information out there. I think we all can agree to that. Whether it's good, whether it's bad, it's hard to really to get through it all. There's so much. So as far as being a patient and survivor for resources, you know, Jennifer, I'll start with you. How do you feel right now as far as the amount of information that's been coming out? And B, where have you been going to try to find information?
So I'm going to answer the second question first. Obviously, the Elephants and Tea website and the COVID resource page. As far as like just general news, I do try to filter what comes in. So of course, go to reputable sites like CDC and WHO. But I have found that I personally don't want to see any more about it. I don't want to see the science, what's, you know, directly impacting me. I know it's bad, and I know I personally need to stay inside. So what I've really appreciated seeing is all the resources and support from just a lot of my Facebook and Instagram, because I know we're all spending way more screen time on those than we were previously. And just like, okay, here's a yoga class, here's a happy hour, different things that are non-coronavirus, but like fun for me to do, engaging, give me something different. I've really appreciated that aspect of the resources from the cancer community and even from outside, you know, just seeing pictures of people's pets, seeing pictures of nature, things that are going to take my mind outside the four walls of my home right now.
Great. And Whitney, again, being a survivor as well, but someone that's working in the hospital setting, how about you as far as the type of information that's been going out there? Have you been trying to relay anything specific to the patients that you're working with? Or is there specific feedback you're getting of people being overwhelmed as well?
Yeah, so, I mean, even speaking as a survivor, I echo a lot of what Jennifer said, that you feel like you're being inundated with everything. And working in a hospital, when I log into my email every morning, there's probably at least 5 emails about the latest updates on the virus, practices in the hospital, all of that. So I've been really conscious to limit what I'm seeing outside of that too. Of course, there's really great resources. There's really good sources of information like the CDC. In Ohio, we're blessed, I think, to have every day there's a debriefing that I always check a little bit on my phone, but I try and limit that. In terms of what I'm doing to help my patients is I'm keeping that in mind. And every day I have been providing a resource guide of some of the resources about, like what Jennifer was saying, some of the fun things that there are to distract you. But also, you know, what are the financial resources right now that so many people are in need of? What does it mean that the student loans are being taken care of for 6 months? What the heck does that even mean? So looking through and sifting through a lot of the really great AYA organizations that are out there, that's what I'm focusing on. And we've certainly done some streamlining of the COVID information. I know Amelia is on the call or in the chat, and she's been really helpful in kind of, we've been doing some PSA type stuff of how do you actually clean your groceries off when your Instacart order gets here. Those are the things that we've been focusing on mostly because there's so much information about the virus and it's changing all the time that we're trying to keep it sifted so it's not so overwhelming all the time.
Allyson, on that note, right, the overwhelming, the sifting through the information for you and I being in charge of 2 organizations where people come to us for information, you know, what have you been hearing and seeing on the stupid cancer side and talking with people? I guess two questions here for you. A, what are you all trying to do right now for folks? And B, what are you hearing from the patients and the survivors?
Well, we're certainly hearing a lot of what Jennifer and Whitney said and what a lot of the comment, I'm kind of checking the chat, and we're all totally overwhelmed with news and emails and things you should do and things you shouldn't do. And in our house, we've put a moratorium on the news. There's only a certain amount of time you're allowed to listen to the news because it's a lot, it's overwhelming, it's triggering. You know, some of the things that we're hearing from folks is that they're desperate for quality information. How do you know what to believe? And of course, we tell folks, go to the CDC, go to the NIH, look at those kind of reputable agencies that are really in it and doing the work. And certainly organizations like Stupid Cancer and Elephants and Tea are sifting through a lot of that to be able to provide it to folks. At Stupid Cancer, we've created a COVID-focused page that can point you to some of those good resources. We've ramped up some of our programming. We've been doing some webinars that are COVID-focused. We brought in an infectious disease specialist from Seattle. We're doing some mental health and wellness ones, just to be able to check in with folks and be able to provide them with some of that top line information they really need to know right now. And we've also we've really ramped up our digital meetup program because we know, you know, as our mission is to end isolation and we know that we are now all isolated in our homes, we want to be able to provide more opportunities for people to get together. So we've been doing our general ones every Monday evening, but have been adding in just fun touch points throughout the day. You can meet for coffee, meet for a game, watch a movie together, just to really stay connected to folks. You know, one of our biggest concerns with this community right now, and we can't impress upon everyone enough, don't ignore your mental health now. This is the time that you really need to start focusing on how you're feeling, both emotionally and physically, and try and respond to that. And, you know, certainly if you need help or if you need some guidance, to reach out to us and we can point you to the right direction. I know there's some panels later that will help you through that too, and I encourage folks to stay on and listen. But this is tough. It's tough for everybody. It is particularly tough for a community that has a lot of fears and anxiety around being immunocompromised. And so we really want people to pay attention to how they're feeling and address those issues head on.
And thank you, Allyson. I think that's all so well said. And for those that are looking for any of the webinars or any of the information Stupid Cancer is doing, Allyson, let me make sure I get this right. If they just go to stupidcancer.org, it's all under programs, correct?
That is correct. There's also a banner on the top, but you can't miss it. It's all COVID related stuff. You'll find it.
Perfect. Awesome. And I think some of you heard, yeah, so there it is. I just pulled up the website on my end. Nice blue banner, as Allyson said. So perfect, nice and easy. And also too, Jennifer mentioned on our end of things, there is a resources page just called COVID-19. Same thing as Allyson said on Elephants and Tea side up on the banner. It has all sorts of different things. It has Stupid Cancer stuff on there. It has our stuff, but also other organizations as well. So it's a really cool resource for people to take a look at. I know I'm going to get to this in a second, but I just want to echo something that Allyson had said too about the self-isolation and not to ignore that right now. We saw it firsthand yesterday on Elephants and Tea side. We've been doing these happy hours once a week, which is something new for us. It was just, hey, let's bring the community together. That just once a week on Fridays, grab a drink, hang out with friends. And we've been doing them for 3 weeks in a row. And I have seen personally every week, people are starting to really wear thin, especially those people that are isolated. So as Allyson said, don't be afraid to reach out to Stupid Cancer. Don't be afraid to reach out to Elephants and Tea or any other organization you work with. Grit Health, for example, too. We're all here to help people out, okay? And if we can't help you with something, we will definitely point you in the direction that you should be going to, and definitely stick around for the second session today for that portion too. Jennifer, I'm gonna circle back to you real quick. What's for you, what's working as far as the resources that are out there, the digital things that are out there that you like the most? I think you mentioned some yoga. I saw a question, somebody asked about a virtual Pilates class. I don't know about if there is a virtual Pilates class. That's one thing I haven't seen come across. I've seen all sorts of different things, but not Pilates yet. And I think that was Sheila, and I will definitely see if, and I know Sheila, so I will find out for you. But Jennifer, to you, what is your favorite thing right now that's been helpful?
I'm thinking about that. So one thing with like the exercise classes, I do like these more cancer specific ones. So like, even if we weren't in isolation, I do like the more cancer specific exercise classes because I don't feel as judged if I don't keep up with everyone. I feel like that's the same in the online classes. I like that it's a slower pace, modifications, and things that for me seem manageable. Like, yes, I can finish this. I can accomplish it. The other thing that I'm really liking right now is all the videos on social media. Prior to isolation, I didn't have time, didn't always like watching videos there, but just hearing that, seeing what people are doing and hearing, you know, their real life perspective has been really cool and made me feel so much more connected to the people I know and even like new people that I'm meeting now. And I have loved the happy hours. I think there's going to be a permanent divot in my head from wearing headsets for so many Zoom meetings through this quarantine. But it's like, that's one thing, you know, there's how many ever people on that, but every week that's spurring different conversations for me with just one-on-one friends I haven't talked to in a while. So like a couple of us who know each other through the cancer community have just been doing our individual Zoom calls, just talking to each other, checking in once a week. New followers on Instagram that we can start communicating and start, you know, sharing memes, of course, and different posts to how we're feeling this week.
Thanks, Jen. And would you say that you're meeting more people right now because of the virtual setups and the digital setups?
Yes, 100%. I feel like my social life is actually a lot more active than maybe it was pre-quarantine, just through all the virtual meetings and connections.
Thank you for sharing that, because I know personally for us with one of our virtual happy hours yesterday, I did have a few people that emailed me afterwards asking for the contact information for someone else that was on there because they bonded and they never would have met up. So, and I will say there were a handful of them that were looking forward to going to CancerCon this year, meeting new people. And I know everyone always meets a ton of people there too. So, you know, looking forward to getting back to that next year, of course, too. I know Allyson is as well. So, Whitney, how often would you say the protocol changes for you as far as working with your patients, or is it really just an overload of information? Because you did mention a little bit that your emails every morning is overflowing, but do you just find that things are changing all every day, hourly? Just kind of curious so people can get an idea for you being in a hospital setting.
Well, for me, it's kind of settled into a routine because I am working from home because of what's going on. So personally, it's not really changing that much every day. We do make some changes based on what kind of resources people are looking for. But if I were in the hospital, I know for nurses and doctors, there's a lot of information coming out every couple of days, every week that is changing. But for what I'm doing and the way that I'm supporting my patients, it's pretty much staying the same way. It's a lot of social media, emails, phone calls, checking in on people, that kind of thing.
Great. Thank you, Whitney. And I know the chat's been very active here, so I'm just going to take a quick scroll before we get to our next question to see if there were any questions. I think mostly comments. But I know Ben on here from Grit. If I do miss any questions, please feel free to just throw them out there at us. We're laid back here. So, but we'll get to some more questions, I think, in a second. And actually, here's a question about the virtual happy hours. Are they conducted on Zoom like a webinar? What's the experience like? Thank you. Yes, they are exactly just as a Zoom meeting. Very easy, very laid back. For Elephants in Tea, they are at 5 p.m. Eastern every Friday. We may try to do some other time frames. We've been getting people from all over the globe, not just the United States. We've been getting people from Barcelona, from Canada. So it's been really cool to see that. And then Allyson, just so everyone else knows, and this is kind of like our next question on here. Your typical digital meetups are Monday nights, correct? And you want to kind of just give the timings of those and anything else?
Sure. So we've been doing the digital meetups every Monday night at 9 p.m. Eastern through Zoom. But since we've all kind of sequestered ourselves to our homes, we've started adding them in throughout the week. So they're at various times to be able to meet all the coast's needs and different activities. So I would encourage folks to check out the website, stupidcancer.org, and you can find when they are. If you want to host one, we're happy to help you set that up. There's really no format. It's just kind of provide an opportunity for people to get together.
Awesome. Thank you, Allyson. Another question here. How about hospital-bound patients? Is there any way to improve their experience during this time? Whitney, I don't know if you want to take a stab at that first, considering your position, and then I think the rest of us kind of chime in from there.
Yeah, I know for our AYA team, what we've been doing is we can make phone calls into the patient's room. There's also a couple of different platforms that we're able to actually have a video conference with them in like a secure way. So that's how we've been reaching the inpatient AYAs and really relying heavily on the staff that are in the hospital to kind of help connect us with them if there's something that they need. But I think it's somehow getting them connected to some of this virtual stuff right now because they're just as isolated as the rest of us are, if not more.
Right, for sure. All right, thank you, Whitney, for that. And another one too, that just the Grit Health also has their virtual meetups too, gang. And it looks like Lauren just dropped that program schedule into the chat, so definitely check that out too. So we've already kind of touched on the next question here. How important is it to continue pushing and creating more digital meetups, hangouts, happy hours, etc.? So Whitney, while I still have you, from working with those patients, you just kind of alluded to it, it is really important to keep people going. Is there any feedback you've heard from any of your patients, whether these have been helpful or anything along those lines?
Yeah, I think kind of what Jennifer already said, that, a lot of people feel a lot more connected right now because of the availability of things. And I think one of the things that I've seen in pulling together a lot of these resources is that there's something for everyone. There's the happy hours, there's the yoga classes, there's virtual walks where people are going for walks together and on, Zoom or Skype or whatever. So I think that there really is a well-rounded combination of resources. I think for a couple of weeks, and I think people are coming maybe out of that a little bit, a lot of us kind of like isolated and kind of shut down a little bit, especially on social media, because there's so much kind of it's inundating you, even with the social aspect of it. But I think that people are identifying who their people are, they're identifying the resources that they like and that fit for them, and trying new things. A lot of people are trying new ways to connect and new ways to share their talents and who they are with everybody else. So I think that a lot of people really are liking these types of things, and a lot of people are hoping that they stick around when they're on the other side of this too.
Whitney, talk about perfect segue. And I know I didn't even ask you to do that, but that was my next question for Jennifer, as someone that's a survivor too. How significant is it to keep things going like this after COVID-19? Would you prefer these digital groups to kind of stick together and keep going, or do you want more in-person stuff, or is it a mix?
I think it would be a mix. I would definitely love to see people in person. But one of the benefits from all the virtual meetups is now I've connected with people across the US. So maybe there is potential for a personal meetup later on, but I would love to, continue the virtual meetings to just keep staying in touch with them, new friends across the US and even like across the globe, as you had mentioned earlier. But I definitely am very much in need of just seeing new people face to face.
I think we're all probably in need of a hug, right?
Yes, for sure.
I could use a few, that's for sure. So Allyson, and again, my next question we've already kind of touched on, but for you personally, with the things you're doing with Stupid Cancer, or maybe even outside of Stupid Cancer, what have been your favorite things that you've seen executed on so far from this new digital world that we're living in?
Well, I think kind of both what Jennifer and Wendy were saying, that connecting with people more. We all have, not that we have more time, but we're all, none of us are commuting, right? We all know we're going to be here for at least a few more weeks. So having that ability to build in more time to connect with people and see people. And I've even found that a lot of my meetings that would have normally been phone calls are now on Zoom. So it's nice to be able to see people's faces. But I think one of the really interesting thing for the AYA community as a whole that has come out of this is this real sense of collaboration, AYA Week being a great example. But from the organizational perspective, a lot of us have come together to really start addressing collaboratively the needs of this community. There's so many of us out there doing such incredible work, but now we're kind of joining forces. And I think there's a lot to be said for working together and hitting different communities and figuring out ways to share information with our community and with each other. We've been working with a few other groups as well as a few oncologists in the space to build out a resource page that's going to be launching next week. But these are, connections that we've all kind of been partners and have been talking to each other, and we see each other at different conferences throughout the year. But I think what's really amazing is that there's a real concerted effort now to address the community in a really robust and meaningful way, and much more so than previously.
I echo everything you said there, Allyson. It's been one, I think it was definitely coming, our collaboration across the entire AYA space. But this outbreak, I think, has forced us to really work together even more so. So it's been really, really cool to see how quickly we all kind of came together. I think it helps we all like each other too. It's been so awesome to work collectively. I think this is a perfect example right here with Grit giving the platform for Elephants and Stupid Cancer to all three of us come together and work for the better of the AYA group. And I think that's what's important is we're here for the patients, for the survivors, those that are dealing with cancer on a day-to-day basis. So the more we can do together, the better. And as far as what we're seeing on the Elephants and Tea side of things, it's been, because for those that are aware of who we are, we do stories and people share their experiences of what they're going through on a daily basis with cancer. And our world hasn't necessarily changed too much, but because of this, these self-isolation, people are starting to, the anxiety's rising a little bit more. So it's forcing, I think, everybody to think in different ways quickly to bring people together, which has been really neat to see, which is why we started been doing more just digital type meetups of things. And people have been begging us to get our June issue out quicker than normal because they want to read about what else is going on and also want to read about stuff that's not necessarily specifically COVID-19. I think there's definitely that there too. So let's see. So I have a comment here in the Q&A. Says it's not a question, but read out. We are shelter in place here in Syracuse for a 5-year-old Roman. He's trying to grasp all this and contemplate that this is life. Can you say hi? Well, we'll say hi. Hi, Roman. How's it going? So everybody say hi to Roman. He's also asking something else, but that's okay. But yeah, so hi, Roman. Welcome. Got to say hi to the kids that are stuck with all of us at home, right? All the parents that have to do different things along those lines. So for those that have questions, I have a couple other things that we'll probably bring up here, but I know we only have about 10 minutes before we move over to the next session here, but to the audience, please ask some questions to us. All 4 of us are here to answer any thoughts, comments, questions that you might have. So please do that. So this way we can answer any questions that you might have. One thing I do want to mention that on April 25th, Grit has their Authenticity Summit. So please be there for that Saturday, April 25th. Myself and Whitney are going to be doing a little bit of a writing workshop, pre-recording for that. So it should be pretty cool and exciting. Talk about the importance of self-expression. And I think that kind of ties into what we talked about, say, the self-isolation and the anxiety that comes with it, and how it can be helpful to tell your story, to write about your story. So definitely be on there to check that out. And there's going to be a whole lot of other stuff going on there from the Authenticity Summit. So while we're waiting for some questions to come in, Allyson, I'm going to throw it back to you. Is there anything else that you want to relate to this community today, specifically about stupid cancer or just in general?
Sure. Well, thank you again, Grit, for having us, and thank you all for joining on today. Again, I certainly encourage everyone to check out all of the groups that are represented here today and see what resources they have and how they fit for what your needs are. And certainly, please reach out to us if there's something that you need that you're not getting. We want to make sure that we're supporting you through this crisis and beyond. Nick had brought up how we were all a little bit sad not to see each other at CancerCon, which would have been next weekend. And it would have been my first CancerCon, so I'm very sad as well. But the good news is we are going to do a digital CancerCon. It will be the weekend of June 6th and 7th. An announcement will be coming out about that shortly, and registration will be open and free for everybody. But we want to make sure that we are able to bring you CancerCon in a digital format as close to the original format as possible. We'll have some incredible workshops. We'll have a lot of fun social activities. So save the date, block off June 6th and 7th to come back together with all of us and join us for CancerCon 2020. And when we see each other again in 2021 in Minneapolis, it'll be like a giant reunion. So we hope to see you there.
That is awesome, Allyson. Thank you for that announcement. I think a lot of people are definitely excited. I know I am. So sweet. We'll see you all digitally at CancerCon coming up. So Jennifer, anything else you want to add for the audience while waiting for some more questions to come in?
So one thing, I know we've spoken a lot about like the cancer related groups, but I think it's also important to do some non-cancer related stuff. So one thing I've started doing lately is playing games like the Jackbox games online with different friends. And that's really cool because it's, something different. Still using my brain, still doing games, and, gives me a break again from dealing with the isolation and all the cancer and COVID related stuff right now.
Awesome. Thank you, Jennifer. Whitney, how about you?
I think the big thing that I would want everybody to know is if you're a survivor, if you're a caregiver for a survivor, this is and can be very triggering for a lot of people right now. Even though we have so many more virtual programs out there, there's a lot of stuff out there. If you feel triggered, if you're feeling sad one day, if you're just feeling antsy one day, it's okay. that's a normal reaction based on what you've been through, what you're going through, what we're going through now. That's like so unpredictable, and we can't even begin to wrap our heads around. So reach out either to one of these organizations, to Stupid Cancer, to Elephants and Tea. Reach out to your medical team, or even just talk to family about it, because chances are other people that you're talking to are feeling the same way. So, there are a lot of resources. There's a lot of fun things that you can do to stay connected. But it's okay if you also don't feel good mentally and physically. This isn't a fun time, so that's okay.
Whitney, thank you. And you kind of just touched on a question that came in from the audience. How do the survivors on this panel become more transparent with their feelings? So to Whitney and Jennifer, was there a specific event or experience that either of you went through that allowed you to open up about your feelings?
For me, that was actually losing my best friend's brother to Ewing sarcoma when he was 25. We kind of tag team cancers and transplants and everything. And then he ended up passing away. And I realized I needed to do something with my experiences. And personally, for me, I felt very convicted not to hide them, but to share my story and to reach out to people. So that was kind of my defining moment. That doesn't mean it's always easy, but I try to remember that like this is a big community and it's more than about just me.
Great. Thank you, Jennifer, for sharing that. Whitney, how about you?
Mine was a little bit nerdier. I was reading a book by Brene Brown, and she talks a lot about the importance of owning your story and who you are as a complete person. And every experience you've gone through is a part of that story. And I was sick when I was 10. So even in college, people didn't know that I was a survivor. I didn't really talk about it ever. And so when I read that, that really made me think a lot about, okay, this is a big part of my story. It's who I am. I mean, I have Brene quotes everywhere. And then I ended up meeting Dave. He was in Rochester, I was in Syracuse, and he drove me to an OMG summit that Stupid Cancer was hosting in New York City. So from there, now I'm here.
Thank you, Whitney, for that. And I will say too, as far as what I've seen from other people opening up, specifically for our role with Elephants and Tea, where people are able to submit their stories to us or even reach out to us looking for ideas to write about. It's been beautiful to see people open up when they put their thoughts or their story in words. And a lot of people have never had a chance or even thought of reflecting on their experience in that way. And so that's something I would recommend to survivors and patients out there, that whether you want to share that publicly, whether that's through Elephants and Tea or through Stupid Cancer, I would recommend writing things down or even recording yourself just with a hand recorder, or nowadays with the video recorder, up to you. But it kind of forces you to rethink what you've gone through. And of the contributors that have done that, a ton of them have said to me, thank you for just giving us the area to talk about what we've gone through, because there's something about that people don't realize, that it's okay to talk about it, right? And so there's something to be said about that. And also too, I know when people are sharing their experience, when they start writing about what they want to write about with Elephants and Tea, it ends up taking a whole different track, a whole different path, because they remember different things that maybe they had blocked out due to some traumatic experience through treatments or whatever the case may be. So don't be afraid to either A, start by privately just sharing things with yourself, but then B, it's okay to reach out to other groups, other organizations, or individuals as well. Allyson, I don't know if there's anything you wanted to add to that question as well, because I know you obviously work with a lot of survivors and patients too.
I mean, I would just kind of echo what everybody said. So much about this is staying connected, and you know, we've always kind of collected stories through our blogs and I think it can be incredibly cathartic. Again, it can be just for you, or it can be to share. But it's really a great way to kind of get your thoughts together and process. And you know, I know you guys, Nick, at Elephants and Tea, do an incredible job of helping people kind of work through that, and we have some programming as well. But you know, I think it's such an important part in sharing your story, is such an important part of your journey and your process, and that happens at a different time for everybody. And I think this kind of goes across the board, as for both patient survivors as well as caregivers, and healthcare professionals in the space. I had lost my brother to Ewing sarcoma when he was 26, and that's kind of how I got into this space. And you know, being able to talk about that really helped me understand better how I could be involved in supporting other patients and survivors through their processes. So I agree that, you know, with everything that Whitney said, that and everything that you've been saying, that it's a great way to just kind of get out there and kind of think about your experience in a different way.
Helps if I come off mute. Thanks, Allyson. That was great, and thank you for sharing that experience too for you. So I think that's it, gang. So Allyson, Jennifer, Whitney, thank all three of you for joining me on this panel today. And again, thank you, Grit Health, for giving us the platform to talk about National AYA Awareness Week and how the AYAs are dealing with COVID-19 outbreak and self-isolation. So again, I think that one of the big key takeaways here is what Allyson said, that Cancer Con will be on, just in a new format. So June 6th and 7th, right? I'm saying that right, correct? All right, cool. I'm getting the head nod from Allyson, so yay. So June 6th and 7th. So be sure to check that out. And again, too, folks, don't forget about Grit's Authenticity Summit on April 25th as well. So awesome. Well, I am going to pass it over to Lauren, I believe. Now, Lauren, is that correct?
Yeah, that's correct. Thank you to everyone who was on this first part of our session this Saturday. It was so great hearing about the resources that you guys are doing with your companies, with Elephants and Tea and Stupid Cancer. Nick and Allyson, thank you so much for all the hard work you do. And Whitney, it was so great hearing your perspective as a survivor, but also working in this space now. And Jennifer, same for you. It was so great just listening to your story and how you become empowered and stay connected and everything like that. And I'm so happy that we had this first part one of today's session as an AYA panel. I'm a cervical cancer survivor, and I was diagnosed about 2 weeks after I turned 23. So unfortunately, I know this AYA cancer space all too well. It's kind of a situation that we don't ask to be in, but we get put in, and that's okay because we're making the best of it. And we have all these great resources that were talked about today. I also want to mention a few others. I'm going to switch over here to my little document that I live by. So in addition to everything that Elephants and Tea is doing, they have a really great website kind of listing out a really good table of things that are going on. And then Stupid Cancer has a good website. We've posted the links in the chat. I've tried to keep up with that and do that. But like they said, it's really easy to just go to their sites or Google them, and they'll have a COVID specific section. Also want to let you guys know about Cancer Care. They have a lot of different fact sheets and online workshops. They have financial assistance, which Whitney had mentioned is something a lot of people are having trouble with right now. So there are those resources out there. Another organization providing some financial support is Family Reach. You can find that on their website. And also all these ones I'm mentioning now are also on the Grit Health website. We have a COVID specific section as well, and we have these listed now. And we were talking about getting active, and Whitney had mentioned there's some really cool stuff going on with some of the AYA organizations. And you don't have to be an AYA to join these things that are being offered, whether it's virtual happy hours, things like that. Epic Experience, if you go to their Facebook page, they are holding events which include a walking workout, they're doing yoga, they're doing ballroom dance lessons, and it's all through Zoom, those really casual, laid back things that Nick was saying. It's really easy to join and attend. The Livestrong Foundation, they have a lot of information on their website with resources from good sources that you can trust. BMT InfoNet has information for blood and marrow transplant recipients, kind of just to know the extra precautions and what they should know after getting transplants. And they also have a tip sheet for managing anxiety during this time. The Young Survival Coalition, Living Beyond Breast Cancer, and the Metastatic Breast Cancer Alliance also have great stuff on their website right now. And so I see here from Shelly, in the chat window, the ballroom dance sessions are held by Epic Experience. They have it on their Facebook page. And I really just want to say I love how everyone's been connecting in the chat window and getting to know each other in this little chat section. That was great. If you have been doing anything and finding things that have been helping you, any books, any shows, anything like that, you are more than welcome to email us at contact@grithealth.com, because whatever's working for you, we want to share it with others. And I want to share Grit's resources. As I said, we have a COVID-specific webpage, and then we are holding 2 more parts after this ends at 1 today. We have Dr. Catherine Benedict on with Swamini, who are going to be helping you work through any psychosocial stuff, give you some support, some skills. That's coming up here in a few minutes. And then at 2 p.m. Eastern time, we will have a doctor and advocate panel discussion, kind of like we just did, but it'll be more science and medical based for that. And we're doing this again next Saturday. We'll be here. And then Nick mentioned our Authenticity Cancer in Your Mental Health Summit that's taking place on the 25th of April. It's going to be a full day, jam-packed. My coworker Jess and I at Grit, we have been setting up some really cool stuff like workouts and meditation. We're going to be talking to nutritionists. It's going to be a really great day and really beneficial. And I also wanted to let you guys know that Grit, our digital health platform, you can either download it on your phone, iPad, tablet, or we also have a desktop version, and we hold virtual meetups as well in kind of a chat room function like you're doing today in this call. It's all chat. And on this Tuesday at 8 p.m. Eastern time, we have a genetic mutation meetup that is run by Jess, who is a colon cancer survivor. She's on the Grit team, and she is living with a PALB2 mutation. So if you or someone you know has a genetic mutation related to cancer, come join us at 8 p.m. Eastern time, talk about the struggles, because that's a beast in itself. And then on the 15th, so next week, we have just a regular meetup in the program's chat room, and that will be at noon, so kind of a lunch hour. If you're on your phone, come check us out, Grit Health, I'll be in there. And we just chat. Honestly, we talk about our pets and food a lot. We keep the conversation pretty light in there. So I am really happy to have had this AYA panel today, and I'm excited to stick around for what's coming up here in a couple of minutes with Dr. Benedict and Swamini, and also stick around again at 2 p.m. so you can hear some science and medical information. And I just want to really encourage everyone, keep finding what works for you, what's getting you through this, and rely on your friends, rely on your family, even though, you know, you're not with them, and really look into these cancer resources that are floating around the internet. There's so much out there information-wise, but there also is so much out there to help you get through this. So keep trying, keep going. You're gonna find what works for you to get through this. And I want to go ahead and pass this off to Dr. Benedict.
Thanks so much, Lauren, and hello to everyone out there. That was Such a wonderful previous panel. I've been listening in and such a great chat on the side, and everybody's participating. I'm a psychologist, just as a brief introduction to myself. I'm out here in San Francisco, California. I work at Stanford. My specialty is working with people affected by cancer, whether that's patients or their loved ones and friends, and working with the community. I work closely with Grit and also with Allyson at Stupid Cancer, so it's great to see her on here. I'm going to do this session a little bit in two parts, although we'll integrate them, but really focusing on the mental health aspects of what's going on, both related to having a cancer experience during this time, and then of course facing all the news and all the overwhelming feelings that were brought up related to COVID and having to be stuck at home and facing all these risks. But before we go on, Swami, do you want to introduce yourself?
Absolutely. Hi, everyone. I'd just like to say that it's such an honor to be here and to be part of this panel of speakers, and that I honor each and every journey that you've been on. My husband passed away about 1.5 years ago from colon cancer. He had a 5-year journey in that experience. And so as a caregiver, and as someone who watched the journey, witnessed the journey of my husband, my heart is with you. I know that this is not easy, and that there's so much that goes with this journey in trying to understand yourself and to understand what's happening. But I am the co-founder and primary spiritual teacher of Kula Kamala Foundation and Yoga Ashram. We are a 501c3 public service organization. I currently also am an interfaith chaplain at Albright College in Reading, Pennsylvania. My inquiry into spirituality started about 40 years ago. And through the grace of God, every step along the way drew me into the mental health and medical health fields. And so while I do teach yoga classes and meditation classes, a lot of my time has been spent working with individuals who are living with cancer, who are living with other medical concerns and illnesses, working with at-risk groups, children and families, working as an emergency response member of a team when there has been crisis, so many different areas of the human condition. And so I'm just really glad to be here and to bring whatever I can to the conversation.
Thank you, and I'm so glad that you are. Last week we talked, well, I have so many thoughts after last session, and there's a lot I want to make sure we get to. But to pick up from last week, and that's certainly online if others want to go back to it, we talked a lot about emotions and how they can be overwhelming and they can be complicated. And the first thing we did in reaction to that was talk about the breath, how sometimes that's the easiest starting place when there's overwhelming emotions. And that came up again this week, of course. Feeling overwhelmed, feeling isolated, a lot of difficult times out here. Can you give us just a brief recap about why the breath is so important? And we're going to move on from that today, so not a total repeat because that's online, but that's where we started. And so introduce us to that.
Absolutely. So the breath has many different functions in our experience of our life. The first function is a physical one. And so the fact that you're breathing in and out is actually giving you life. So there is this experience of the physical body through the breath. You know, the inhalation feeds into our energy and our functioning of our physical body. It helps the cellular structure break down and rebuild. It oxygenates the blood and the brain and the organs and systems of the body. And so the breath in is so powerful in our physical experience of just wellness. The breath out is detoxification and relaxation. And so the breath out is also inherently linked to our physical experience of being alive. It's most people don't realize, as I mentioned last week, that the breath is actually the greatest detoxifier of the body, Most people think it's bowel, urine, and sweat, but it's actually not. It's your exhalation. So if you're not breathing properly, then you're not detoxifying your body properly. So the next way that we experience the breath is spiritually. So if an individual is so inclined to that inquiry about how to feel that connection, to their source or to each other or to this planet or to nature, or to just their experience of life from a psycho-emotional spiritual place, then the breath is what brings us there. And in great part because it's so linked to the nervous system. The inhalation is very closely associated with the state of fight, flight, with activity. And the exhalation is very closely associated with the parasympathetic function of the nervous system, the ability to relax and be present. And so here, when we are looking to come into a deeper connection with self, with others, with our source, the breath is very important, because if the breath is chaotic, the mind will be chaotic. And when the mind is chaotic, connection is not possible. When the breath is calm, the mind is calm. And when the mind is calm, connection is absolutely possible.
I love that. And one thing that came up when I was listening to the last session and now listening to you speak is that we described a lot of difficult emotions during this time. And again, related to a cancer history and what that means for how we're experiencing it right now. And I loved all of the conversation around community and how do you connect with other people. But I think if you, I want to take a moment to recognize that making that jump, making the decision to reach out to somebody, to find a community, to find those resources, there's steps in that process first, right? And as you were speaking, I myself was taking deep breaths and calming down. And in that moment, finding calm, finding stillness, it gives me space to make smart decisions about what do I need right now? How do I understand myself with what's going on, and find adaptive ways and helpful ways to react. So let's talk a little bit about what happens in those in-between moments, and how do we understand what are emotions? How do we understand what's going on? I think the physical sensation, your chest tightening, and even the outward sensation of feeling angry and snapping at the other person in the room or whatever it is, those are easy, they bubble to the surface, but how do we understand the emotions underneath?
Yeah, all such great questions. And I'd like to just go back to for a moment to something you said about, taking a breath in order to understand what you need. Well, we can go back even one more step to that and say, if you're not breathing mindfully, if you are in a state of inner chaos, if you are in a state of fight or flight, then you're not listening consciously, so you don't know what's being offered. And what's being offered in great part has something to do with what is available to address your needs. So we also, we need to take it back to a moment of listening consciously. And I also want to say that Nick, Whitney, Jennifer, and Allyson reminded us of the importance of talking about what you've been through, journaling on your experience, sharing your story and perspectives when you feel you're ready. So how do you know when you're ready? How do you know when you're ready? How do you know how to organize what it is that you wish to share? You need to know what you feel, and you need to understand why you feel the way you feel. And what we tend to do with regard to our emotions is we lump them all into one basket. We say, I'm either happy or I'm angry. And sometimes there's a third basket, sad. But that basket is usually dumped into the angry basket. We need to understand that there are a plethora of emotions. So to start with, there's 6 primary emotions. Sometimes there's 8 or 10, depending on who you're reading. But these 6 basic emotions, happiness, sadness, fear, anger, disgust, and surprise. And each one of those has a set of secondary emotions, and then each one of those has a set of tertiary emotions. So when it comes down to it, we actually oftentimes use 2 emotions to express the impact of dozens upon dozens upon dozens of emotions and feelings. So we need to refine. We need to take time to become aware of what it is that we are feeling, so that we become empowered to address the needs that we have based on those emotions, those feelings, those reactions, and those responses. And I do like to liken this to diagnosis, right? So many people on this feed today have been diagnosed with cancer. So you're not going to go to a heart doctor to treat your cancer. You're going to go to an oncologist. You're going to use the medicines and the information and the wisdom available for the condition that you're trying to address. Emotions are the same. If you call everything anger, then you're misdiagnosing yourself. And the medicine that you will take will not be for what you're actually experiencing. The medicine that you're taking, whether it be, your journaling or your reading or just even the consideration of what to do in a circumstance, will be oriented toward an emotion that you might not actually be feeling. Yeah, so I think that answered you.
Yeah, no, absolutely. And I wanted to talk more about, and I loved that metaphor, particularly how it's so easy sometimes to just lump them in baskets without taking the time to look at the nuance and to look at what's underneath there. Can you talk to us? Sometimes when I work with people, the negative emotions feel wrong, or they feel like they need to be pushed away really fast, or they're just too painful and too overwhelming. Are there such a thing? And okay, so from my perspective, right, all emotions are important and helpful at times. They can, however, feel overwhelming, particularly because I think we're in a place of culture. If you look at any kind of self-help book, there's almost this message that you should be happy at all times, that the ultimate goal is to wake up every single day and be happy. And if you're just strong enough mentally, you'll be able to make that shift. Can you talk to us about the importance of the whole spectrum of emotions and being able to experience those, and why we have them, and how do we honor them?
Absolutely. So first, let's just go back and say, if an individual wishes to be a sword fighter and they wish to go into competition for sword fighting, they need first to understand how to fight with a sword. They need to have understanding, skill, wisdom, education in how to deal with an opponent in a competitive arena in that way. Similarly, people have to learn how to play football. They have to learn how to write a book. Everything that we do, we need to learn. Our society doesn't teach us how to deal with, how to facilitate, how to respond to our emotions. You're absolutely correct. Society puts up big billboards that show people smiling. Everything is great. We watch TV. We see that every single emotional situation that a person or a family or a community encounters can be resolved in 30 to 60 minutes. And we begin to set up subconscious expectations that our life should be so easy and that we should always be smiling like that person on that billboard. But the reality is that that person on the billboard is smiling in 1 second of time in a lifetime of seconds. It's not realistic to think that we will always be happy. And the spectrum of emotions that we encounter on this path of life are meant to be facilitators of health and balance with regard to whatever it is that we are encountering. So if we come into a moment where we lose a relationship that meant something to us, we have a medical diagnosis, we fail a test in school, we need to have an emotional relationship with that experience in order to bring our sense of self back to a place of homeostasis that is healthy, and not into a place that is just simply stuffing things that are overwhelming. But we're not taught how to do that. We're told from a really young age, be happy, smile. Your smile makes other people happy. Don't make people uncomfortable by talking about what's going on with you. But the reality is that if we want to be a healthy society and a healthy person, a healthy community, have a healthy life, we need to talk about our frustrations, our sadness, our disgust, our happiness, our joy, our surprise. We need to talk and explore every gamut of our emotions. And spiritually speaking, and of course, you know, I'm a Swamini, so everything comes back to spirit. Spiritually speaking, if you talk to most people who are of a spiritual mindset or a religious mindset, one of the major goals in their life is to connect to source, is to come to understand that they call God or goddess or whatever name it is that they use. When we are existing in a state where we are denying some part of ourself by pretending always to be happy, or even pretending always to be angry, then we don't have enough space within ourselves to have a deep and meaningful relationship with God. We don't have enough space within ourselves to have a deep, meaningful relationship with ourselves. So how can we have enough space to excel, to become skillful, to surrender into that other relationship? We don't. And so to educate ourselves in a way that allows us to understand the diverse nature of our emotions, the purpose of those emotions, which is to eventually return to a state of homeostasis or inner balance and optimal functioning, that is so very important for the experience of a healthy life, a balanced life. If you are so-called a spiritually or religiously focused life, and a life of compassion and service to self and to all others within our community. Yeah.
I'm so glad you talked about that, because there's multiple things going on, and I want to make sure we get to both of them. And one of them is understanding ourselves, that connection with oneself, and then how do we communicate to others, including be of service to others, you know, to touch on what you just mentioned. An important thing that I think is really important is not only how we're forced to be happy often, and we're not taught to understand our emotions. One aspect of that is that you can feel multiple emotions at the same time. And what's been coming up for me a lot, and the people I work with during this time, is that, and we heard earlier today, that dealing with COVID right now can be triggering. And almost a PTSD symptoms come up. It is very real that many of these risks are real, and that for this community, they're even more serious than for others. And there's fear, and that is, that's an appropriate reaction. At the same time, is there a way to draw, to feel empowered from having been through tough experiences in the past, to draw resilience, to be of service for others? And can you hold both those things? I'm afraid, but I'm also resilient. What are your thoughts on that?
Again, such wonderful thoughts, and thank you for that. I completely feel that yes, we can hold a space within ourselves for both our concern, our anger, our sadness, our grief, as well as our inspiration, our joy, our happiness. And as a matter of fact, I feel we must. I feel that we need to, in order to really be authentic in who we are, and to embrace an even greater level of resiliency. So the first thing that I would like to say is that an exploration into the conditioning and condition and potential of our emotions is necessary in order for us to become truly of service to ourselves and to our community at large. We need to be looking at understanding ourselves better in order to be able to understand all others better. Because when we are denying a part of ourselves, like let's just say that I have depression. And as a matter of fact, after my husband died, I went through a depressive episode because, you know, I lost the physical presence of a person who meant so much to me. Now, I could have stuffed that down. But if I'm willing to stuff down my own experience of depression, how will I ever authentically acknowledge yours? And acknowledgement and recognition of one another is the most important service that we can provide to each other. Because every other service that comes after that, whether we're providing food, providing shelter, providing medical care, has to come from a place of recognition. Recognition of our humanity, recognition of our diversity, recognition of our complexity, recognition of our simplicity. So additionally to that, this ability to sit with these feelings that are uncomfortable. Depression is uncomfortable. Anger is uncomfortable. Disgust is uncomfortable. Happiness can also be uncomfortable. As you said earlier, Catherine, when you mentioned that we always have to feel happy according to, the message we receive. And is it okay not to? And we feel in certain instances, like right now, well, how can I have moments of happiness when the world is in such chaos over this pandemic? Well, you're going to have moments of happiness because you're surrounded by love. You're going to have moments of happiness because you're surrounded by connection. You're going to have moments of happiness because no matter whether there is a pandemic or not, you still have dreams and visions and aspirations for yourself and for all others. And joy, happiness, bliss, inspiration are what are going to feed those dreams, those ideas, those intentions. Whereas if we just exist or force ourselves to only exist in a state of fear of the unknown, then our dreams, aspirations, and visions are going to go into hiding. We're not going to know that they're still thriving with us.
Yeah. So I'm reading some of the chats here, and Marie just said it's exhausting to keep a brave, happy face. And that's true. It's also exhausting to always be fearful. And that's the moment we live in right now. And just to hit home this point that there's so many layers to this and there's a lot going on. What is your advice for both turning inward to understand ourselves? How do we do that? In the last session, we talked about journaling. How do you sit down and even journal? Sometimes that's the simplest thing, but what is your advice? And then, I have a thought on this as well that I want to finish with, but if things start to feel too overwhelming, what can we do?
Yeah, again, all great questions, all great questions. So the first thing that I would suggest doing is spending just a little bit of time, it doesn't have to be a lot, in taking a look at the emotions that you're actually experiencing on a day-to-day, hour-to-hour, minute-to-minute basis. There's lots of resources out there. You can get the psychology list of emotions. You can go online and do a search, and you can start working with the top 6 or 10. There's plenty of charts out there. And you can take a little bit of time to journal. So when you're experiencing something, let's just say that you have an encounter with another individual and that's a difficult encounter. Take a few moments post the encounter and write down what you think happened from an emotional place. Where was I emotionally? Well, I was angry because that person was wrong. Well, okay, what other emotion might fit in to what it was that you were feeling? Look at the list and then journal on that a little bit and give yourself the education to understand your own diversity and the responses and reactions that are available to you. So that would be one thing, would be to just maybe read a little bit and then to do a few very simple exercises in coming to understand what it is that you're actually experiencing. And yes, it can be really overwhelming. Absolutely. Someone asked, do you feel it necessary to control your emotions? And the answer to that is both yes and no. To try to control your emotions through what we might call a state of ignorance, which is to not even look at them, is harmful to yourself. So by stuffing your anger, stuffing your grief, stuffing even your happiness is harmful to yourself. The control of our emotions comes from understanding the emotions. So I'm a trauma survivor. And there was a point in my life where my emotions really got the best of me. It was difficult to to address them. It was difficult to contain them, and they constantly took me by surprise. It wasn't until I sat down and I started identifying what I was feeling in any given moment. And I sat with that emotion and I said, well, this emotion is fear. And this is what fear does to my body. It enters my body through an increase in temperature, through more shallow breathing, through trembling. And okay, so what am I afraid of in this moment? And is what I'm afraid of in this moment the result of the past, the present, or the future? And eventually, what those types of inquiries, which you need to work with a licensed psychologist, such as Dr. Benedict, in order to really come to a healthy place with them, what you end up finding out is that many of the emotions that you feel, you don't need to react to. You can respond healthfully. And that's what draws us back to the homeostasis, is understanding what needs our attention and what doesn't, but not denying any of it.
And an important thing there is to know that emotions are not permanent. Recognizing, and as you're saying, sitting with them, you not only don't have to react, but knowing that this does not have to be permanent. Now saying that, I want to make it very clear that if an emotion, particularly an upsetting one, an overwhelming one, becomes too overwhelmed, and anyone out there feels like they may harm themselves, please reach out and get professional help. Reach out to your care team. The American Psychological Association has a website, the American Psychiatric Association, and so that's really important to get help when one needs. And then someone had an experience or had a question saying the coping strategies. And so we talked a little bit about those. Once we sit with ourselves and we kind of have a better understanding, I think then we're in a better place to communicate with the people around us. And again, that's reaching out to community, but we all have people in our lives that are connected to us, that we did, saying that you can't choose your family, in some ways we're stuck with the people around us. And in times like these, I've been really hearing from the patients I work with, from the community, that they just don't understand what I'm going through right now. And that's very much reminiscent a lot, particularly with the AYA community, having gone through a cancer experience. There's maybe some people are still in the midst of their cancer experience now, on top of this, dealing with COVID, that they're facing a different experience. How do we communicate with others who might not be understanding that when people are affected by cancer, they're in a different situation. They face different risks. They might have different emotions. How do we communicate with others about emotions, particularly when they're difficult and that makes people uncomfortable?
Yes, wonderful questions. And I'll go to my own experience with my husband to start this. My husband said to me at one point early on, he said, you can't understand. And he was right, because I wasn't going through it, he was. But what I could do was come into an understanding of what was available to be understood. And that can only be had through conversation and communication. Not ever trying to tell him what he felt, but listening consciously as he shared with me what he was going through. And those are two different things, because I think as someone who loves someone who has a cancer diagnosis, we want you to be okay. We want you to, we want the cure. We want you to be the person that we always envisioned you to be, not worried about life, not worried about death, not worried about chemotherapy or treatment. We want all that to go away. And that's very wonderful. It's a very wonderful intention, but is it real? So as caregivers, on our side of things, we need to come to a place where we are listening consciously and holding a space for self-expression that is a non-judgmental space. The individual who is living with cancer, what I feel is helpful is for them to name their emotions. I am afraid, and this is what I'm afraid of. I'm angry, and this is what I'm angry about. I'm frustrated, and this is what I'm frustrated about. I'm disgusted. I'm happy. I'm joyful. I'm inspired. And for them in that moment to acknowledge that what they basically need in that moment is to be heard and not to be reacted to, is to be heard and maybe not even to be responded to. So we each, if we want to support each other in a way that is meaningful, then we need to come together in a conscious listening experience where we're holding space for each other, we're willing to communicate, we're willing to listen, we're willing to not speak unless asked, and where we are accepting as the truth whatever this person is sharing with us about their experience. We are denying nothing. Denying nothing. Yeah.
Yeah, and I think it's communication means not only communicating about what you're feeling, but communicating about what I need from you. And so being able to say those words, I just need you to listen right now. And I know this is hard for you. I know you love me. Please just listen. Another aspect of that is knowing the person on the other side of the communication, and really deciding that, you know, there's decisions around disclosure in some relationships. Who do I want to share feelings with? Who is a good support, provider, recipient of the communication I need to talk to? Sometimes that's a healthy relationship, and sometimes deciding not to disclose is also. And in those moments, either finding another avenue, such as a community of people who have been through what you've been through and get it, quote unquote. And sometimes, again, that's drawing on personal strengths. So, I mean, I don't want you to leave this conversation, but I do want to bring Dave in now if he's ready to share his experience. I know he's had a long journey with his emotions in connecting with them and finding truth.
I would like to just add one more thing. If that's
sorry. Yeah, please.
Because I don't usually talk about this in the panels, but I do just want everyone to know that I had thyroid cancer about 15 years ago. I was very fortunate. I never had to have treatment for it. It was well encapsulated and they were able to extract it via surgery. But I'm speaking from both sides. I'm talking about this from the aspect of being a caregiver. And I'm also talking about this from the very fortunate experience of being a survivor as well. So yeah, thank you for that. Just wanted to say.
No, thank you so much. Oh, so, and that was an awkward transition. That was not a graceful transition. But my point was, I wanted to bring Dave in the conversation. I wanted to keep you on board, Swami, because what I'm trying to get out here is that there's multiple tools in the toolbox, right? Yeah. And being able to understand oneself and one's needs is the first step. And then being able to take the right tools, and tools meaning, because we're going to switch to the patient community, whether it's Vivibot, which Dave will tell us about, or whether it's connecting to the people around us that are there for support. So that was, again, not graceful, but Dave, why don't you jump on in, tell us a little bit about your experience, which I know you've shared to the world, but for anyone who's new, you've had a long journey with your emotions and cancer and now COVID.
Wow. I have to first start by honoring and acknowledging how much we're sitting together among some really intense emotions. And I don't know what everyone here, both on the panel as well as in the audience, is feeling, but I feel how differently I've understood my emotions over time. And there's been such a mix of comments in the chat on the side. I spent 10 years repressing all of my emotions, Swamini, because I was too afraid of them. And outwardly, I looked well and adjusted. Inwardly, I felt a lot of rage. And it took me 10 years to get to a point that I saw others learning how to express that and getting to that point, which now, so I was 25 and 30, my two diagnoses. I'm 43 now. So boy, that journey started 18 years ago. And so I've spent the last 8 years trying to be more connected to the fear and the anger, rage inside of me from going through my own diagnoses and losing my dad to cancer and feeling like I didn't do enough to support my family. And these are all really, really intense emotions. And so, Catherine, I wanted to acknowledge that before I get into responding to the question, because, you know, just the fact that we're sitting together in this is the start of being able to heal from it. And you know, we spend so much time as a team thinking about how to set these programs up, you know, and by design, this point that we're at right now is living between, you know, the AYA awareness, you know, panel that we did with young adults, and then we're about to move into a physician and scientific, you know, and advocacy space. And, you know, this place that we're in is coping with all this. And so I want to acknowledge how much this is intense. And I just want to honor that before I try to describe it, if that makes sense.
Well, before you go on, and I don't want you to lose your train of thought, but to connect it back with what Swamini was talking about with anger or full-on rage, if you can think back to that Dave who was feeling all that rage, what was going on underneath? Rage was bubbling to the surface, and if you think of like the iceberg where only the tip is showing, what was underneath that for you, as an example for others who, you know, might be having trouble understanding their emotions?
You know that I'm known as the crier on our team, so if you're trying to draw that out, I have to give you kudos. Because you know me and have been a part of that healing for me, so much of what everything below the surface was for me was the shame and guilt and anger I felt from the path that I thought my life was on and how trauma interrupted that. And specifically, I mean, going through radiation therapy and healing from surgeries and those kinds of things was physically taxing, no question about it. But coping with losing my fertility, grieving the loss of my dad, these were things that I had no skills or practical ways to cope with. And so they lived really intensely below the surface, and just even finding ways to start to let them out took me 10 years.
And again, I'm going to continue down this path. How did you start to find ways to let them out? And someone on the side was saying, you know, how can I get my boyfriend to look under the hood? How do you start this journey?
Oh, I have goosebumps. There's been so many examples of me seeing others and believing that if other people can do it, there must be a way, or maybe I can try to. And that, you know, Stupid Cancer was among the first, and CancerCon, and, you know, there is such a history. I wish I could include the past 8 years and all of those moments. One of the speakers who's going to be at our session on the 25th, our Cancer and Your Mental Health session, Stacy, I remember seeing a picture of her in a magazine, and she was showing her scar, you know, from her cancer all the way down her abdomen. And she stood there in such a way of owning it that I remember just looking at it and being in awe of someone being able to own their story, especially when none of us expect to have these scars or these, you know, surgeries or the loss of these functions that are so basic to our humanity. I always thought I was going to be a dad. I never questioned that. And to lose that still is a deep, deep loss that I try to cope with. And when I see others own their story and be able to find ways to talk about it, I feel us coming together. And I never, you know, had I stayed the Dave I was, I would not be this way, or I don't know that I would have gotten through it, to be honest.
Yeah, and I'm going to put a slightly different label on that. Owning your story also means recognizing vulnerability, and then recognizing vulnerability to oneself is a difficult, and then putting that to the world is another one. And that's in some ways a strength we can build up. You know, you can take baby steps towards that. And I think if you're doing it in a healthy way and you find the right outlets, which is a whole other conversation that we can talk about in the coming weeks and stuff, you start to learn little by little that you build strength, and that was a positive experience. And it becomes easier maybe, or at least rewarding. How about that? I want to transition again to Dave, because we had things we wanted to talk about, and we want to talk about Vivabot, but that word vulnerability. So Mini, do you want to just comment on that? Because I think it's such a powerful word, and it's really underlying a lot of what we're talking about right now.
Certainly. So vulnerability is such a core experience for every human being. And, you know, going back to the beginning of our conversation, when, you know, you were talking about, you know, what we've been kind of programmed to feel, it steals the vulnerability from us, that we can't become honest about our feelings. We can't share with people for fear of being a burden to them. The reality is that vulnerability is what allows us to connect with each other. You know, that to come to you and to talk to you about my experience with cancer, my experience with caregiving, my experience with faith, my experience with anything, opens up the ability for the two of us to have a conversation. And that conversation is what makes that vulnerability into a strength. That when I can talk to you and you can talk to me and we can listen to each other consciously, then that vulnerability becomes a strength, because now we've learned something about each other. Now we've learned something about each other that without facing vulnerability and without engaging in vulnerability openly and honestly, maybe we would have never shared with each other. We can't support people unless we give them permission to be vulnerable. We can't support ourselves unless we give ourselves permission to be vulnerable. And that means taking a real good look in the mirror and asking ourselves, what am I dealing with right now? What am I feeling? What am I reflecting? Where am I? What am I doing? And then being open to the answers that come from within yourself, as well as from, you know, if you're talking to a professional individual like yourself, Catherine, you know, or your doctor, or, but you have to know yourself first. And in order to do so, you have to give yourself permission to be vulnerable to what you're experiencing.
Yeah, thank you. And the recognition that it's not a one size fit all. It's not even a one size fit all every single day you wake up, right? Some days you have the strength to think through these things and to be with yourself or to be with others, and other days you don't. And those are the days you do exercise classes on Zoom or ballroom dancing or whatever it is, you know? So this is really about trying to recognize your needs, accepting where you are in any given moment, right? We talked a lot about mindfulness, and doing the things that you need to do to connect with yourself and connect with others. I don't want to ignore the questions that are happening on chat, and I don't know if you're looking at them also, Dave. I think a couple of them are for you about faking it, but then once you start to, I guess it's almost like walking the walk can teach you how, or something like that, you know? Can you comment, Dave, what your experience was like?
Yeah, when I saw the first question, it made me remember, you know, how much after years of stuffing things down, it was not a tidy process for me to start to deal with those things. Before I could find words to express what I was going through, I got a tattoo on my chest and I wrote, "Too short to waste 1 second," because I felt the preciousness of life and I didn't have a voice yet. And so my way of expressing it was to put this tattoo on my chest. And I remember there was a point where somebody judged me for that. And the rage that I felt, because that was the only way I knew how to express what I was going through, and feeling so judged for that, which was something that I was so proud of, flooded me with this rage that I had been repressing before then. And fortunately, someone in my life said, maybe you should go meet with somebody and talk to a therapist. And that was the first time that I did go see a therapist. And I was amazed at how much I had been burying that started to come out just by seeking help. And, you know, the day before that came out, if you had asked me, and the questions I see in the chat, I love so much. If someone had asked me, Dave, how are you doing after cancer? I would have said with a big smile, I'm wonderful, you know, and then that moment of just that anger pouring out of me forced me to confront how much I wasn't okay. And that was the start of the first time I went to meet with someone to deal with those things.
Yeah. And I don't want anyone to take this the wrong way. Sometimes I use it when I work with patients, but I know them, I have a relationship. But faking it till you make it is not necessarily a bad thing. In the most like benign sense of the term, sometimes I say, like, you know, I'm someone that gets up and runs every single day and exercises and makes sure, you know, I'm not. But if I can convince myself, if I can just do that for this day, then one day I'll be that. You know, you take these baby steps, and you don't have to be the goal. You don't have to be the one who's so strong that they can be vulnerable in any minute, and so strong that they can recognize any you don't have to be that perfectly the first day you try, right? It's a journey. Dave, we've gone completely off script of what you and I had planned to talk about.
may I stay with that point and then
yes,
I know
Sumini,
so there's one comment, and then Sumini, I'm really eager to hear what you want to say, but the faking it thing, right? You know, air quotes. My journey has been guided by watching people that I admire and seeing people being able to share things and talk openly, you know. And in the beginning now, 8 years ago, you know, somebody would help me see that I could do something or a way to talk about something, and then I would pass that advice on. And when I was passing it on, I felt like I was a faker, like, you know, this is something I learned from somebody else. I'm just sharing it now, you know. And I feel like in many ways, we're all at some point on that journey. You know, 8 years ago, I was just learning everything I could. And I heard Whitney earlier in the session today talk about how her first time coming to a cancer event, I picked her up in Syracuse and drove her to the Stupid Cancer OMG Summit. And I had forgotten that moment, but that was me trying to help somebody in a way that I had been helped. And Whitney sharing that brought me back to where I was 5 years ago. And you know, we're just always all at some point on that journey.
Absolutely. And I just wanted to contribute to that because this word faking is such an interesting word. You know, I remember back when I was in elementary school, prior to elementary school, I had no idea what division was. I didn't believe it existed because I had no idea what it was. And because I had no idea what it was, somebody had to teach me how to do division, and how to do multiplication, and how to put a sentence together. And in the moments where I was learning, I was not faking, I was learning. It was a process of learning. And we've gone through our lives being told what we're supposed to feel, which negated the truth of these other things. We're not faking, it's just a different perspective of it, because I look at words and the power of words. And what I see is that we're recovering. We're actually recovering a part of ourself that we've denied. So you could say that you were faking it before and you're not anymore. That before someone told you, well, you can't be vulnerable, you can't be sad, you can't be this, you can't be that. And so you went along with what they said. Even though there was something inside of you that was saying, no, I feel this is here. You know, so you chose a facade to make someone else happy. I'm not saying you did, but I'm saying we all do. Then a day came, and that day you chose to embrace your inner vulnerability and the greater level of diversity that exists within your self-expression. And you chose to learn about it. And that's where we are. That's what you're saying, Dave, is that we're all somewhere in that spectrum of learning. Yeah, and I think that's empowering. I love that. Absolutely.
I love that perspective, Swamini. I mean, you look at a baby, a child, they experience the range of emotions. And then slowly we learn how to control them, or some emotions are better to express than others. And we learn right and wrong in terms of sharing with other people. And so let's go back to what we previously knew and take those baby steps. Dave, do you have any final thoughts before? Because I want to talk about Vivibot, because it's so important to also just have those moments with oneself. And I think Vivibot can help with that. But
yeah, just the last thought that I wanted to share is that when I was finally able to start letting things out, I remember being shocked how people told me how strong it was. And I had always felt that letting those things out showed weakness. And when I was able to finally allow them and to talk about them and to connect with people, them saying how strong that made me. And it was the opposite of what I was fearful of. And, you know, having those conversations gives me courage to keep having more of them. It's always risky and always vulnerable, but the more we lean into that and the more we come together, Swamini, you used the word authentic several times. And, you know, my greatest hope is that we live authentic lives. And this is the path to do that.
yeah, and a final thought, that authenticity also means honoring the things that are true. And whether that's, because I'm seeing and I want to thank James for sharing his story in the chat, because he mentioned how, again, the mix of emotions, and you can instantly, you feel angry that you're experiencing something difficult, and then guilty because you don't have it as bad as someone else. And that mix, that back and forth, what are the right emotions to feel? What do I feel okay and not okay to feel myself, and then share with others. And I just, if anyone out there gets anything from this conversation, it's please just to honor and not judge those feelings. I think judging is a word that Swamini will probably jump on board of, that please don't judge yourself, honor the emotions that are coming up, and they can feel scary and overwhelming, but we've talked a little bit about ways to sit with those. I'm trying to time manage here. Swami, do you have any final thoughts on just judging emotions before we switch to finish up with Dave?
Sure. So we've spent a lot of our lives judging ourselves harshly, critically, and without a good outcome. And so now is a good time to stop that. Now is a good time to become discerning. There's a difference between judging and discerning. When we judge something, we are typically putting a negative lens on it. We're typically, especially when we judge ourselves, we're demeaning and minimizing our own experience, which is what James was sharing before. And thank you so much, James, and to everybody for everything you're sharing in the chat. When we become discerning, when we practice the art of discernment, what we're saying is, so everything has a lesson to it, and everything has a value to it. So what is the lesson? What is the value? And how do I apply it? Is this the moment to apply it? Do I understand what's being presented to me? Do I understand what I'm feeling? Do I understand what I'm thinking? Do I understand the connection to those things? Is now the time? So discerning is a really useful tool to use. Judgment, not so much. None of us likes to be judged. We say that word and we all cringe. Everybody's shoulders kind of went up like this, you know? So judgment is not going to serve us, but discernment will, because discernment is part of that learning process. Yeah.
Thank you so much. If I can repeat, because this needs to be on some website somewhere. Grit, Dave, are you listening? What is the lesson? What is the value? And how do I apply it? And that's kind of a more useful way of thinking about things. I mentioned a couple of times now. I've mentioned a couple of times now how I'm terrible at time management, but in our last few minutes, talking about Vivibot, because I think Vivibot's a very powerful tool that can help with some of these things. Because we're saying these words right now, but then, you know, someone shuts off their computer and they wake up tomorrow and there's no roadmap for how to do it. We talked about journaling, we talked about breathing, we talked about taking some moments, but Vivibot's another tool that can help us find adaptive or helpful ways to cope in this difficult time. And again, I want to bring up the fact that we're in a very intense moment. This is not just dealing with cancer. This is dealing with the combined effects of the increased risk and the COVID. And so, Dave, what is Vivabot? How can it help us? Why should we know about it?
Yeah, thank you. What I'm so proud of is how much has gone into creating this. And so the really passionate team at Hope Lab, which is a social innovation nonprofit organization that focuses on underserved and unaddressed issues. And these feelings that we're talking about fall into one of those categories, especially for people who have gone through young adult cancer. And so they have spent the last 3 years creating Vivabot, which is a positive psychology tool to help each day with practical skills to help us focus on different ways to move through some of those hard emotions. And so I will share my screen. And Catherine, if I can ask you, please let me know if we have any technical difficulties while I'm doing this. Does it seem to come across?
No, I'm seeing your screen.
Okay, perfect.
We're good so far.
Yeah. So Vivabot was developed as a chatbot for young people dealing with life beyond cancer. And all these things we're talking about, wasn't having cancer hard enough, right? Dealing with all the emotions and everything that come up from it, are things that can overwhelm us in ways we've never expected. And so this is available on our Grit Health platform. Just go to grithealth.com/Vivabot. We'll put the link in the chat bar so that everybody can see it. And there's more information here. You can read some of the videos of individuals that have been a part of creating this. And really, Vivabot helps us learn and practice 7 helpful skills, which are gratitude, mindfulness, acts of kindness, personal strength, positive events, attainable goals, and positive reprisal, or reinforcing things we're going through. And this was developed by leading psychologists and psycho-oncology workers to address the needs that we face as people going through cancer. And so on the website, Grit here, you can just click on the Grit community, and it takes everybody into our Grit Health platform. This is where you can connect with others, share your experience. If you click Discover, this is where our platform matches you to people in similar situations. I'm a 43-year-old 2-time testicular cancer survivor, and you see that our platform is matching me to Stephen and Todd, who are also very similar aged, very similar diagnoses, and I can connect with them for people who understand. If I click on Vivabot here, it says hello and a little introduction, and then it brings me immediately into the Vivabot conversations. These are 10-minute check-ins each day. And even for me still now being as far out as I am from cancer, they still help me deal with what I'm going through, acknowledging it, right? So Vivabot, she asked me, let's take a moment to take stock of your mood. How happy are you feeling today on a scale of 1 to 10? I'm at least a 7. I'm definitely dealing with some issues, but I'm at least a 7 because we're all together. So I click on 7.
I love it. Dealing with some issues, but
that's a summary. But yeah, how sad are you feeling? I have to admit, hearing things we're all facing, I feel it as a survivor and a caregiver. I feel it. So definitely, I'm sad today. I'm at a 3 today. And I'll just do a couple of more of these so you can see how worried my worry is relatively low. It's a 2. How excited? Well, we're all together. I'm really excited. How irritable? I'm not very irritable today. I'm doing well. And so just by doing these check-ins, how content, it then sort of assesses where I am, and then it takes me to, real inner strength to admit how you're feeling, even if it's a robot telling me, right? Now that I've noticed my emotions, go me, I feel good. I've got a skill that I can work on with Vivabot, and so bring it on, Vivi. Let's take a look at the skill. And so she's going to take me now through one of these different positive psychology skills. I appreciate she's telling me that I'm awesome sauce wrapped in badass. I feel good about that. So,
Dave, I'm going to interrupt real quick because this is awesome. Everyone out there can see like the beginning of what an exercise would be like. And we only have 2 minutes left. And I want to just hit home the point how again, these are tools in our toolbox because it's amazing to connect with a community. And we're human beings. We can't live this life without connecting with other people. But sometimes that's not what you need. Sometimes connecting with another human brings on a whole layer of emotions of what are they thinking about me? Do I have to worry about their feelings? That comes up a lot with loved ones, right? And I really share what I'm feeling because I'm worried they're going to then be worried about me, you know? So can you talk a little bit, just in the last minute, what it means to have both of those tools in your toolbox, connecting to humans, but also just taking time for yourself and connecting with a chat bot, or, you know, just doing this where there's no worries on the other side, that this is an exercise for yourself.
Yeah, thank you. This is what I wish I had before I knew how to deal with my emotions. You know, 15 years ago, Dave needed this. And that's why I'm so proud that we have this for people who are just starting or who have something new that they're dealing with, to be able to have this space. You know, it's a judgment-free zone just to work through some of these issues. And so, you know, everybody is at, or can be at, a different place. And there are times when this is incredibly helpful. There are times that sitting with somebody is really meaningful, but to have these different tools is how we keep moving through everything.
Yeah, and just to answer, to wrap it up, thank you, Dave. Thank you so meany. To wrap it up, Vivabot was developed for young adults who with a cancer history, but now it's for everybody. It's for caregivers. It's for everybody, right? And we have lots of people using it in the app. And again, I encourage everyone to explore what they have available to them, explore these different options, whether it's on your app, whether it's on a computer, of connecting with others in a digital space, connecting with Vivabot, or turning the computer off and journaling, or turning the computer off and taking some deep breaths. So experiment with what you need and when you need it, and what works best when it works best, because it's not always going to be the same. Now I'm 1 minute over. I don't know how to transition. Someone will take over, but now we have an excellent panel of doctors now to move into the more medical information piece. Thank you, guys. Thank you, Swamini.
Thank you, Catherine. That was perfect. It's my honor to introduce the team with the American Association for Precision Medicine. Very quickly, when COVID became as intense as it did, I was fortunate to connect with these individuals through Dr. Kamala Madali, who's part of our advisory group, and meeting Prashun and Arun these last, I think not even 6 weeks now, maybe 5 weeks. We've put together beyond what I knew was possible to bring together experts and really human, really remarkable people. And this is now our 3rd session in this virtual series. And what's been so amazing to me is that, you know, these panels bring together experts from very different perspectives. So we have physicians who are treating cancer patients. We have scientists and researchers who are involved in the diagnostic and testing of COVID. We have advocacy leaders who are supporting the community. And all of these multidisciplinary perspectives are just so amazing to bring together. But what's really, really struck me is not just how people are coming from different areas together to solve problems. It's how we're allowing ourselves to come together in how we address it. And so these individuals that you'll hear from and get to interact with next are not only experts in their field, but they are some of the most remarkable humans I've ever met. And they'll talk about what it is like to do the work that they do, and also how it affects them, because many of them are also survivors and caregivers and advocates. And, you know, for us, and Swamini, I have to give you credit to acknowledge all of who we are openly is how we can connect. And just the last thing I'll say is that for the team at American Association for Precision Medicine and all of these experts, several of whom you're going to hear from immediately right now, showing up the way everyone is, as real and as human, is how we will get through this really tough moment with COVID, but then also for the lives that we're creating after it. And so I will leave it with that. We are going to have an update from Dr. Mishra, who's the founder of AAPM, and then he's going to bring on this expert panel. And so it is with deep honor and gratitude that Dr. Mishra, I welcome you to the conversation.
Good morning, good afternoon, and good evening good evening all, depending upon where you are dialing. And I, Crystal Mishra, welcome you to the scientific panel. And what amazing discussion! A hard act to follow, but we are scientists, physicians, and we can give you sugar-coated pills, but the information that we will give you that is cannot be sugar coated, because our job is to deliver the right information. So one of the responsibilities that was given to me was to give you an update about a little bit about the AAPM Act, as well as what's happening in the therapeutics field. So I thought I will share that, and then I will let the team take over. So I'll share my screen, and let's see if this. All right, I think, can everybody see my screen? So yeah, so I think so welcome everyone. So what I thought to do is I will give you an update on in the therapeutics area what is available, so that patients or caregivers can directly take an advantage of it. So I would start by giving you an overview of the pandemic, and you can see U.S. is leading in this pandemic right now. U.S. is one of the it has surpassed, I think, Spain, Italy, France, Germany, and China, and one of our job is also to fight misinformation. And I think some of you must have seen that in past few days, an article was circulating that COVID-19 is now the leading cause of death in the United States, and it has overtaken heart disease and cancer, and which is not true. CDC has released yesterday a statement saying that no, the coronavirus is not the leading cause of death in US. Since this is a cancer and COVID forum, I thought for us it's either it's a cancer #1 or COVID #1. For us, it's it's the same concern, and I personally believe that every life that is lost either to cancer, COVID, or heart disease is a life lost, actually. So what my appeal to the whole field is to come together and see whatever we have learned from this pandemic in terms of regulatory approvals, in terms of accelerating drug development, let's keep it. And even though the pandemic passes, let's be in the pandemic mode in terms of drug discovery and development for cancer and other diseases that are taking lives routinely in the clinic. So with that being said, New York State has is now is the epicenter of COVID-19, and the death tolls in New York is greater than several countries, including China. So these are, and so this is a fact, and I would ask you all to have a moment of silence to honor all those lives that we have lost to COVID. Thank you, everyone. So, a little bit about American Association for Precision Medicine and ACT Task Force. The goal of AAPM is to accelerate the field of precision medicine through research, education, communication, and collaboration to faster new medical breakthroughs. So to do that, we are bringing together the 4 P's of precision medicine: patients, providers, public health planners, and payers to work together to achieve the common goal of delivering improved outcomes. So the goal is how to deliver the promise of modern medicine to the patients. And AAPM was one of the first to form a coronavirus task force in early January, and we called it AAPM Coronavirus Task Force. So ACT, abbreviated as ACT, we have several departments, and these are our this lists our clinical leaders, executive team, and chairs. We have several departments led by an eminent leader, and each department consists of 8 to up to over 20 members and team leaders working 24/7 since January 21. And ACT is utilizing this unique ecosystem that American Association for Precision Medicine has created. We have technology partners, we have investor community, we have member companies, hospital, healthcare institutions. We partner with academic institutions, and we have a rich network of startups that are part of this ecosystem. And together, the goal is to not only catalyze new innovations, but also train, mentor, and advise the companies that are for them to become successful. So ACT is a unique ecosystem of experts and corporations providing expertise in mentoring, domain expertise, ecosystem connects, funding, and data, and data-driven ecosystem. And together we have ACT and partners have access to over 1 million patients and community members, and 25,000 professionals, and over 500 startups. And AAPM Grit Health, this initiative is a part of that that calling that we all had, is how we are also a knowledge base, so how we can come together and share our knowledge to demystify some of the misinformation that's out there and make a difference in lives of patients. So with that, I have already talked about the flattening the curve. What the flattening the curve really means is that if the infection rate is very high, the healthcare system gets very much overwhelmed. And then quickly physicians have to engage in who to serve and who to a triage, so who will live and who will die. Whereas if we flatten the curve, where we do not overwhelm the healthcare system, and we will have the services available for patients that are coming in, then we will reduce deaths. So that's what our healthcare system is focused on. And this is something that I have put together. So depending upon where you are dialing in, some of the in US, in some areas do not have ICU beds. So the green areas are the hospital systems that do not have ICU beds. And I had tried to overlay with the coronavirus infections, and as well as, so you just make sure if you are in that that region where there are no ICU beds, you make sure the county to just get in touch with your county and see what are the arrangements they have made for patients care and hospitalization. So, and I talked about this before, the clinical trial for the vaccine for COVID-19 has already begun, and this is a remarkable effort, but it will, for the vaccine to be available, it may take 12 to 18 months. So therapeutics is the only choice that we have. So, so what are the, so in ACT internally, we been working on repurposing existing drugs and also finding new drugs for the COVID-19. So our new drugs have to go through the clinical trials and can be accelerated through the regulatory approvals. And so happy to share that we have successfully developed an antibody against ACE2 receptor. And we are also working on potential drugs to prevent deaths in COVID-19 patients by reducing ARDS, acute respiratory distress syndrome, that kills most of the patients. And in clinical trials, we have few drugs that are in clinical trial. One is remdesivir, which is a Gilead drug, which was originally developed to treat Ebola and has efficacy in coronavirus. And we have also a Genentech drug, which is approved by FDA for phase 3 clinical trial. It's called Actemra, and is now the clinical trial is being enrolled in multiple sites. And also I'll talk about convalescent plasma, which is one of the new therapies of delivering filtered plasma from the patient who have recovered. So they're taking the plasma from folks who have recovered and then giving it to the folks who are now suffering with COVID-19. What are the developments there? So just an update. So this paper came out yesterday. This is from the remdesivir compassionate use. So the paper was published in New England Journal of Medicine, and I think that there is some positive message that came out of this study is that patients that were hospitalized for severe COVID-19 and treated with compassionate use of remdesivir showed clinical improvements. So approximately 36 of 53 patients, so that's 68% of the patients had a positive outcome. So, and then the larger clinical trial is already ongoing. So this is good news. And also for the anti-IL-6 drug Actemra, I think one of the positive stories that has come out is Dr. Drew Jones. I would encourage you to go through this article and see. So he was identified with, he was diagnosed with COVID-19, and he went through different stages, and he tried few drugs and they did not work for him, and then he was put on Actemra, and he felt better. So he said that, so this is the drug that's already in the clinical trial, and you can see where it's available near, if it's available near your in your state where the clinical trial is enrolling. And so this drug is good to prevent or cure the pneumonia that is caused by COVID-19. So also a clinical trial of hydroxychloroquine for COVID-19 has already begun. This is the NIH clinical trial. So hydroxychloroquine, of course, is endorsed by our U.S. president, and a lot of companies have, graciously provided the free hydroxychloroquine to several patients. But so evaluating the clinical trial data, it's still, so there are certain clinical trials showed that there's a beneficial effect, and some say that there was no benefit. So I think this will be a very good an approach. So to assess that, what is the benefit of hydroxychloroquine for COVID-19 patients. And just to let you know, the hydroxychloroquine came out of the ACT task force. This is one of the first recommendations in January that we discussed, and we also studied all the clinical trial data, and we have comprehensively designed the clinical trial analysis, and it's happy to see that this drug has entered the clinical trial. So our recommendation is, let's see what the results are, and we'll make a decision based on that. So approach that is becoming very successful is or it's at least the early results I'll show you there positive. It's using convalescent plasma, so filtered blood from patients who have already been infected by COVID-19. So the rationale is being that patients who were already infected, they have developed antibodies and immunoglobulins in their blood, and if we just take the blood cells out and take the plasma and inject the plasma in the patients, then we will have so those now antibodies will go to the patients who is suffering, and then with the COVID-19, and then they will have a better response. So Mayo Clinic has already taken the lead, and this is already being done in 100 clinical sites in US. FDA has already released guidelines for use of convalescent plasma in. So what they say is the healthcare providers or acute care facilities would obtain the COVID-19 convalescent plasma from FDA registered blood establishment. So if you want to be part of this site, this clinical, so you want to be one of the clinical sites, you can join hands with Mayo Clinic, or if you are a patient and you want to be part of the trials, you can see if your site near you is recruiting. And so this is one paper that I will discuss. This came out of in mid-March last month, and they suggested that so there were 10 severe acute cases, and they were treated with 200 ml of the plasma, and so they published that the patient very well tolerated that, and also they had viremia. That means the viral count almost disappeared. So this was very encouraging, and they suggested that that a clinical trial would be warranted. So so this is just a chest CT of two different patients. I can just show you, and so you can see the first. If you see the left hand side, you can see there are more. It's not so clear, but the right hand side, if you see the one that were treated with convalescent plasma, it becomes more clear. So then the viral load has been cleared. So this is one of the positive things that have come out, and I think so still it is tested in the clinical trial. So we don't know if it will work, because this is not a new approach. This is a very old approach. If it works, we will, it's amazing. So let's hope for the best. So I will leave you with this. So there are, not only cities, but countries have been responding to this pandemic, and we all have to learn, from each other. And one of the countries that has become a role model is Taiwan. Taiwan was, initially when the outbreak began in China, I think John Hopkins predictor suggested that Taiwan will be the second most highest country that would have this infection, and Taiwan has successfully applied all the learnings during the SARS outbreak to contain the COVID-19 pandemic. And this is a great, so what the measures they have taken is a great learning. So, I encourage you to go and see this, how they have done it. And then I think we all will learn a lot from it. And with that, I bring you to the panel. We have the amazing panel ahead, led by Dr. Arun Sivanandam. And so Arun, please take it from there. Thank you. Thank you very much.
Thank you so much, Dr. Mishra. That was a great introduction and great science that we'll delve into Hi, everybody. Thank you so much for joining in. For those that have stayed for the past 2 sessions, this is the 3rd session. For those of you who are newly joining in, welcome as well. In this 3rd session, we're going to go a little more scientific with some clinical experts that I have from around the country joining us, as well as a leader from patient advocacy group. And so let's get started. My name is Arun Sivanandam. I'm a clinical trial specialist at the Stanford Cancer Institute, where I deal with GI and neuroendocrine tumors. I handle investigator-initiated research in phase 1 through 3 oncology and immuno-oncology clinical trials. My personal story connected to cancer was in my final year of medical school. My dad, who is a cardiologist, deals with people's hearts, and he has such a big heart of his own. He unfortunately contracted a glioblastoma, which is one of the worst forms of brain cancer that you can ever get. I went home to be his primary caregiver, and we did everything we could for him, including enrolling him in a CAR-T clinical trial. But he passed away 1 year after diagnosis. And I made a critical decision then that I wanted to focus my efforts on clinical research full time, and I haven't looked back. In addition, the journey going through that with him as a cancer patient has made me a strong cancer patient advocate. I wanted to join the AAPM ACT task force, the coronavirus task force, because when Dr. Mishra approached me, I thought about the opportunity to work with thought leaders in different disciplines and see collective genius in action in order to create unique solutions to unmet patient care need all around the world. I also had the opportunity to interact with Dave from Grit Health and the amazing Grit Health team, which is a cancer advocacy group. And I was able to be exposed through the previous couple of sessions, the past few Saturdays, to many other foundations, such as Crush It for Curtis Foundation, Living Beyond Breast Cancer, Livestrong Foundation, and now others, including Elephants in Tea and Stupid Cancer earlier today. I want to give a big shout out to some of my mentors who have really encouraged me in this process, including Dr. Kamala Madali. And while we go through this panel and I have the panelists introduce themselves, I'd like all of you out there in the audience to start participating. Please type in the chat box where you're dialing in from. And since it's AYA, or Adolescent and Young Awareness Week, let us know what makes you a young adult. I still feel I'm pretty young at heart. So with that, let's get started with some of the panel introductions. I have with me Dr. Cindy Hu, who's an infection control officer at Jefferson Health. And panelists, when you introduce yourselves, please talk a little bit about yourself, where you work, including experience and specialty, what your professional interests are and a hobby, and why you chose to participate and what you hope to provide to the audience today. So could I start with you, Dr. Howe?
Hi there, thanks for the introduction. My name is Dr. Cindy Ho. I am an infectious disease doc, and I work with Jefferson Health in New Jersey, but of course, what I say today is just representative of my own opinion and experiences and so forth. I do have a connection with cancer, which is that unfortunately my niece also succumbed to a glioblastoma multiforme many years ago. And I was invited to this basically because I was kind of on a different webinar through my undergraduate Yale and made kind of some introductions that way. So I do take care of COVID-19 in the hospital, and I have interests in antibiotic stewardship, sepsis, and infection control.
Wonderful. Thank you so much for that, Dr. Howe. Really appreciate it. We also have with us Dr. Guy Boyke, who's a gynecologic oncologist, that was a mouthful, and a robotic surgeon with McLaren Health System of Michigan. Dr. Boyke, welcome. Please introduce yourself.
Hi, Arun. It's good to be with you. I have watched the previous 2 sessions and enjoyed them very much. It was particularly interesting, the last session today, with all the emotional and psychological support that goes with patients, something that we've dealt with, but to hear the professionals talk about, it's a slightly different twist. I am a G1 oncologist. I've been in practice for almost 30 years, both academic and private practice. Now I'm an employed physician with a large healthcare system. I've done about 10,000 surgeries. I've seen about 6,000 new cancer patients, done tens of thousands of cycles of chemotherapy. And I always tell patients you have to look for the fun things in life. And when you feel well, you should do something fun. If you finish a treatment regimen, you should acknowledge the strength and courage it took to go through it, including going on a trip, buying yourself something. And I tell them I enjoy every day. It's really given me an appreciation for life that is hard to explain. I'm currently in Arizona. We had surgeries on Thursday, March 19th, and our hospital system said no elective surgeries for a month. I went to the office on Monday, the 23rd of March. They said no office visits for a month. So I signed up for telemedicine, got on a plane the next day. I'm in Arizona for 5 weeks, learned telemedicine. We're not operating, but we are doing telemedicine. I also have I have senior residents from 2 different hospital programs to teach. This is impacting them. So I give you a brief, the other side of it, from the provider side. My office staff, I have a nurse for 29 years. She feels we're abandoning our patients. She feels that our treatment is not the level of care that we've provided beforehand. She doesn't understand why we have to cancel surgeries and office visits. But on the other hand, she's also worried about contracting coronavirus, giving it to her husband who has some medical problems. My nurse practitioner is pregnant. She cries every day. She's worried she'll get it. She's worried her baby will get it. So she's taken off 2 weeks beforehand and will be off for 12 weeks afterwards. Medical assistants, receptionists are all worried that they're not going to get paid, that their hours will be cut, that they may lose their job. So this is the part that we're going through. I have watched the updates from the task force almost every day. Obviously listened to the seminars from the past 2 weeks. I've also listened to 2 webinars from our society, one on telemedicine and one on how it impacts G1 oncology patients. And I'm absolutely amazed at the lack of specific information. So what listening to the task force, they say high-risk patients, age, heart disease, hypertension, diabetes, asthma, lung disease, coronary artery disease. I haven't heard cancer mentioned in one of the briefings. I may have missed it, but it's not listed there. Our society, the Society of G1 Oncologists and the American Society of Clinical Oncologists have certain recommendations they've made. One, that we should all follow the mitigation guidelines, both personally and in our practice. They're stressing limiting patient exposure with a major emphasis on telemedicine, which has not been part of oncology. You know, it's been in existence for decades. It's really not been used in oncology by decreasing patient exposures going out. But they also went through a series of studies showing that your risk of delaying surgery, if you have a low-grade uterine cancer, even a high-grade uterine cancer, delaying surgery 8 weeks or more, there's no evidence it affects your outcome. If you have an advanced ovarian cancer, the recommendation for 3 cycles of chemotherapy with a delay in surgery for almost 4 months, almost a standard to begin with. They cite for cervical cancer, delaying surgery or treatment more than 8 weeks, no evidence that it's harmful, and they base that largely on the fact that cervical cancer patients who are diagnosed during pregnancy frequently wait 20 weeks to get treated until they deliver. They also specifically, if you're on chemotherapy, to reassess the real need to be on chemotherapy. Is it primary treatment or are you advanced recurrent? Switching, if you're on a multi-drug regimen, to switch to 1 drug instead of 2. decreased doses to decrease the risk of bone marrow suppression, switching to oral chemotherapy if possible. So there are a lot of different moves trying to reduce someone's risk of having to have contact with the healthcare system. So hopefully that will improve. And the final thing is telemedicine. In the conference on telemedicine, especially specifically for oncology, the challenges. We have elderly patients, and I've noticed in the office over the years that a lot of elderly patients come in with tablets. They have smartphones. They FaceTime their grandchildren. They have some tech savvy, but it's certainly not uniform across that whole patient population. So there is a certain disparity in access to the necessary equipment, to the internet, and in the use of telemedicine. They also, during that webinar, had some interactions with the attendees. Almost all GYN oncologists currently are doing telemedicine with very, very few office visits. Almost all of them have postponed all but the most necessary surgeries. And it's a strange thing to think about a cancer surgery as being elective, but I think that's pretty much where the society has gone. Many patients before this move called in and canceled their surgeries on their own because of the fear of coronavirus. And also it appears that after the COVID-19 crisis simmers down, that almost all GYN oncologists plan on continuing telemedicine as a major part of their practice. So I think we're going to experience some digital revolutions, whether it's in healthcare going forward, certainly in education. You know, why do you have to go to class and spend so much money when you can do so much online? And so that's kind of where we stand right now. I'm doing telemedicine offices a couple times a day, but I'm trying to take advantage of the time. I play guitar, I play in a blues band. I like to golf, I like to exercise. So in Arizona now, I'm hiking every day, golfing, practicing music, doing telemedicine, and trying to be as informed as I can.
Yeah, thank you so much for that, Dr. Boyke. Really appreciate all the information you gave there. And I'll be diving in with some questions to follow up. I just want to make sure we have enough time for everybody and the audience as well to answer questions. Patricia Goldsmith, we also have her. She's the CEO of Cancer Care, a major cancer advocacy foundation as well. Patricia, do you mind just briefly introducing yourself, and then let's start diving into some questions I've prepared?
Certainly. Hello, everyone. I'm Trish Goldsmith. I am the Chief Executive Officer at Cancer Care. Very happy to be here today. Cancer Care is a 76-year-old organization based in Manhattan, and we are literally inundated with all of the requests, challenges, and issues that cancer patients and their caregivers are experiencing on a daily basis. The need for information, the need for psychosocial support, the need for financial support is extraordinarily acute. We are learning a great deal about how COVID-19 has a far-reaching impact on cancer patients, both from the financial, psychosocial, and as well as the quest for and the hunger for credible information and understanding during this challenging time. I'll stop there. I think you, in the interest of time, want to launch into some questions, but I'm very happy to talk more about the services of Cancer Care.
Yeah, thank you so much, Patricia, for that introduction and talking about Cancer Care. I'm really excited to see all the amazing things you guys are doing. Let's start diving into some questions. I'll be directing it to each of you, and then I'll be taking some audience questions as well. Audience members, please feel free to type in the Q&A about any questions you have, and we'll try to address them. Just a couple of quick disclaimers as a reminder. One is that the panelists here are experts, but they're representing their own views and opinions and not necessarily on behalf of their institutions, especially the clinical panelists. And if you have detailed medical questions about your condition they really should be directed at your medical care team, including your oncologist, because they know the most about your condition history. Now let's get started. My first question is to Dr. Ho. How infective is this coronavirus compared to other viruses like the flu or the common cold?
So it's really very contagious, and you can get on all to these different numbers, but many of you have probably seen these curves and talk of doubling and kind of flattening the curve. So it's just extremely contagious, and much more so than some other viruses. And that's the concern, and just the fact that people can be hospitalized. And there's of course a wide range of patterns clinically as far as, all the news out in New York, you're seeing of how, everybody's headed to the hospitals and so forth. So it's just extremely contagious, and in simple terms.
Yeah, thank you for explaining that and breaking it down a little bit. In some of the previous sessions, and guys, if you've missed our previous sessions, they're recorded. Please feel free to go back and watch them. We talked a little bit about flattening the curve and what that means with social distancing. We talked about some protections with masks. But Dr. Hu, I wanted to follow up a little bit about some of the diagnostic testing that's being explored here in the US and all across the world. I know that it's been a little slow kind of picking up and establishing that testing, but I'm also understanding there's different types of testing. Testing like RT-PCR, testing for antibodies, at-home testing, drive-through models. What are some of these different tests aiming to do, and what are they good for?
Well, as you know, a lot of what we know and how many people are impacted is really limited by the total number of tests. And as more entities have gotten on board with testing, we've been able to test more and find out who is infected and so forth. And of course, there's also limitations in the tests and so forth. And so for the majority of the time, really, you're just testing those who are so-called symptomatic. And there's different kind of what we call turnaround time, which is otherwise abbreviated as TAT. So you would imagine that if you're in an acute care setting like a hospital, the turnaround time for a hospital that might have the tests and or be able to send them to a lab that has an expeditious turnaround time could be a lot faster. And so, for example, there are different commercial companies out there, some of which you can get the results very quickly that you've probably seen commercially. And then there are others that maybe is a state lab or a lab affiliated with a academic hospital setting. There are also commercial labs out there. And essentially, as the commercial labs came on board, they oftentimes, at least in the beginning, they were able to get turnaround times much faster. And now everybody's using them. And so the turnaround time can be sometimes 5 or 7 days. Generally, when you have these kind of drive-by tests, these are sort of the persons that may have symptoms, but are generally not necessarily as sick that they would need hospitalization. And so the diagnostic tool for that, again, also depends on who is operating the drive-by and then what tests that they have. But in general, when you see the drive-bys and the hospitals and urgent cares and so forth, most of them are using a variety of a swab that seems like, if you're the recipient, you're gonna kind of really flinch because it's called a nasopharyngeal. And so it's not quite like a little bit into the nostril, but kind of, extremely high. And so generally then that is put into a tube, which is called a viral transport medium. And globally, just a lot of people are getting that tested. And so there's even a shortage of that. And then it is kind of sent to this or that lab for processing. Now, the sort of what you've heard about the game changer is the serology. And the main reason for such huge interest in serology is, well, I mean, it's for many reasons. Did you have it at one point? Are you now immune? Could you sort of go about? And you could imagine that various people are really interested in this. From a healthcare worker standpoint, they might feel more comfortable with, continuing their shifts and not unintentionally exposing someone if they're maybe an asymptomatic carrier, for example. And then this is part of the presumed strategy that some people might entertain as far as, when does life slowly return to normal? some people might feel more comfortable if people were able to be tested with blood work. And the issue with the serology is at this juncture, there's kind of a slow process as far as who is able to actually offer those tests. There's been some hints from the CDC that they'll have these blood tests soon, and then you've probably heard of maybe one commercial lab that was approved by the FDA, although they're some company I was not familiar with, and then there may be universities that may also have these blood tests. So it's up and coming, and certainly I think that will definitely be a game changer. There's a potential that there would be people who are potentially asymptomatic now, but they want to know if they were maybe exposed before, because they might be interested in donating plasma, for example, but they're not actively symptomatic now, so a swab would not detect anything, as an example. So there's a lot of different tests, and these are some ways of preventive strategies as well, as we get to know who is infected or who had the infection in the past.
No, that was great, Dr. Hu, to explain about the differences in the testing and some of the challenges involved in getting those tests up and running. Kind of going along with that, Patricia, I wanted to turn it over to you. Are you seeing a lot of concerned patients who either aren't able to get tested and don't know what to do, or are trying to figure out what type of test to get and who to get in contact with? And what type of resources does Cancer Care offer those kinds of patients? I'm sorry, Patricia, you're muted. Please unmute yourself. Thank you.
I'm so sorry. I think testing is one issue, but I think it's not top of mind right now for many cancer patients. And that is because they are first trying to figure out how they will get to treatment. Should they go to treatment? Are they able to get to treatment safely? There's a lot of differing information for patients out there about even whether they should be tested or not. Are you symptomatic or not? In addition, many of these individuals now feel very isolated by virtue of the fact that social distancing is a reality. For other individuals, they themselves or their family have lost their job, potentially lost their health insurance. We're dealing with a situation now that, quite frankly, is far surpasses what Cancer Care experienced during 9/11. We are based in Manhattan. Of course, we're a national organization, but the level of desperation that we are seeing from our clients, the level of hunger for information and financial support is absolutely unprecedented. To give you an example, our call volume is up about 50%. During the first 28 days of March, just Cancer Care, not our co-payment foundation, received over 6,000 calls. And these are not simple calls about where do I get a mammogram, or gee, do I need to have a colonoscopy? I'm 50 years old. These are all very complicated calls from individuals that are frightened, feeling isolated. We've had individuals that have called us and said, I don't have food. I don't have water because my well doesn't work. I can't afford groceries. I can't take my child to treatment because I can't put gasoline in my car. So this is absolutely unprecedented in so many ways. We are on a quest to raise over $2 million in financial assistance. We've already raised over $1 million. Anyone who's in active treatment, who has an FPL level of a certain point, will receive $500 from us. We provide our psychosocial services free of charge. The education, we have quickly ramped up to provide much education on COVID-19, including our Hallmark Connect Education Workshop, fact sheets, etc. We are hoping next week to roll out a novel program of helping to transport cancer patients to their community oncologists. We're practical, psychosocial, and education, and this time is unprecedented for us and our clients.
Thank you so much, Patricia. I think Dr. Benedict had a question about what is the FPL level that you were referring to?
Each of the grants have their own specific FPL, but in general, it is an FPL level of 300% or below. And then in the tri-state area, which is New York, Connecticut, and New Jersey, it is 400%. And so again, that's calculated based upon the size of the family.
Okay, and I think Dr. Hu just pitched in as well. So FPL stands for Federal Poverty Level. I'm sorry, I didn't know that either. So I'm glad.
I apologize. I apologize. And I should also mention that Cancer Care has a separate corporate entity, a co-payment foundation, where we help individuals that are struggling to afford their medication. And in those circumstances, grants per year can be $5,000 to $10,000 to defray the costs of high deductibles or co-payments.
Thank you so much for clarifying that, and for all that you're doing. Even though you guys have been overwhelmed, it is a period where everybody is trying to adjust with that. Dr. Boyke, I wanted to pivot a little bit to you. I know that initially you mentioned when all of this started happening, you were trying to figure out, challenges with the IT department and telemedicine. I can tell you, my mom, who's a family practitioner, she still types with 2 hands. And, she's like, oh my gosh, now I have to deal with all of this stuff with the telemedicine, etc. But in addition to that, you're a robotic surgeon, from what I'm understanding, and you take out these cervical cancers using a robot. Now, have there been clear guidelines about how to utilize or clean that robot and how to go about doing that in this situation? And what have you guys done as a workaround for that?
Well, I haven't done any robotic surgeries since this all started, end of March, when they came out with no surgeries. That's an excellent question. Intuitive, that makes the only robot commercially available, just came out with cleaning guidelines last week. I have contacted the head of our OR, and I said, to lower my risk of exposure, I wanted to move 2 block time surgery days, which were Tuesday, Thursday, to be back-to-back Tuesday, Wednesday. I said, I want to know what the cleaning protocol is. I want to know who cleaned it. I want the robot cleaned the night before and the morning of, and I want documentation of that. And then we also have residents that are used to having parts in surgery where they get to do things. And our society has said that resident training and fellow training should be at a minimum, only parts where they're necessary. And for me, usually they're not necessary. So I have to deal with, when I go back, what am I going to let residents do? Because you put your head right into a console and you're sharing whoever sits there, whatever's going on with them. We had a urologist 2 weeks earlier that had influenza A, and he had used the robot. And I said, why did somebody let him do it? I have requested the hospital, considering, and I would ask Dr. Hu this, why not do coronavirus testing on surgical patients? Even if they're asymptomatic, most of them are elderly and have medical problems. And for their exposure, not to mention for anesthesiologists and nurse anesthetists, I think we ought to know those things. So that is a particular concern, and a society's struggling with it.
Yeah, no, absolutely. And I think, Dr. Boyke, people have talked about, as these new serological tests are coming out, as to who's recovered and who's still actively, having the infection. People are talking about immunity cards, and that could lend to people going back for these elective surgeries, people going back to work, and contributing to herd immunity. Dr. Ho, can you talk a little bit about the concept of herd immunity and what this kind of serologic testing can contribute to in the absence of an active vaccine that's still being developed?
Yeah, sure. So herd immunity, you've probably heard about when people have been vaccinated and so forth. And vaccine.gov would call it kind of community immunity, that the more that you know that people have had an illness, and could that offer some protection to others? And until we get the vaccine. And the issue is that even after you get a vaccine, there's still going to be some people, potentially the cancer patients that are here or amongst ourselves, that they may not be able to get the vaccine as well. And so there is a reliance on potentially others to have gotten this, and you might be able to check via blood work or serology. And then to Dr. Boyke's point about kind of testing people, I would love to test more people. We just really don't have all the tests. And the other issue, I think, is that with this illness, it's just so bad that so many people are ending up on ventilators. So heaven forbid if one of our elective cases, if you needed a ventilator or something, and that's part of the issue. And so in my mind, what if there were some of these outpatient surgical centers that are not in use at all, to kind of pivot that to a kind of a non-COVID surgeries that are needed. And then potentially from there, at least doing screening by history and so forth. So I mean, it's just such an amazing challenge in really ways that we never thought about. At least I never did. And so it's a struggle, because when you have cancer and know somebody who had cancer, you kind of want chemo like yesterday, or the tumor to be out like yesterday, or like a long time more than yesterday. So.
Thank you so much, Dr. Ho. I wanted to pivot back to you, Dr. Boyke. There was a wonderful article that just came out recently. I'm going to type it into the chat box. All of you, please feel free to go read the article. It was from the New York Times, and it's about an interaction between a doctor and a cancer patient in the midst of the coronavirus outbreak. And so one of the issues is, with all of this telemedicine, we're actually extending the concept of social or physical distancing for the public to medical distancing for the medical community. And that medical distancing takes place either in the office or through telemedicine. Now, how do you still maintain that same level of compassion if you're not able to touch a patient and show them that it's going to be okay?
It's not even just touching. It's being close enough to really see facial expressions in 3 dimensions, not 2 dimensions. It's getting the warmth of your voice. There's especially patients that you've seen, as you know, that you've seen for a long time. It's diving into their personal history. You always kind of pick up where you left off. I write things. We have a mixture of EMR and some paper charts. And I always write something interesting about the patient on the front of the chart, and then it builds over time. So you miss that warmth. And having done some new patient visits for patients with cancer, it's kind of hard. Their adult children always want to get in the picture, and it is a challenge. So, but I think it's going to continue. And I'm looking at my office staff. They think it's going to go back to normal in 3 weeks. They said it's not going back to normal if our hospital lifts our surgery restriction. We're going to still try to social distance, and I like you coining medical distancing. I think you should get that out there in the public, because it's really a true thing to protect the patients, their families, and the healthcare providers and their families. But it's different. I think it'll be okay. And I think going forward, once this is over, there's going to be a lot more telemedicine in oncology, but there will be office visits for those patients as well.
No, that's great. Thank you so much, Dr. Boyke. Everyone, just to let you know, we are going to be running a little bit over time. Please stay with us as we're going to try to get through a few more questions, and I really want to get through some of the audience questions as well. So Dr. Hu, I just wanted to check with you because we were talking about medical distancing here. What are some of the infection control policies that have been tightened for some of the patients who are trying to come in, and even the healthcare workers who are either trying to come in or who are already inside the hospital and outpatient setting? You're muted, Dr. Hu. Please unmute yourself. Thank you.
So there's kind of different infection control guidance, and kind of if you work in whatever setting, there's kind of seems to be a guidance that changes like day to day sometimes, or even hour to hour, as there's different folks that are providing some guidance. And so from an infection control standpoint, you know, you don't want this COVID-19. And so what can you do to prevent? And a lot of it is hand hygiene and kind of taking it to the 100th degree. As you might be able to imagine, as an infectious disease doctor, I wash my hands a lot. And now it's even more than a lot. There is something called the 5 moments of hand hygiene. I didn't really uncover that until maybe somewhere in my residency, and it really changed the way that I wash my hands and the number of times I wash my hands. And that has to do kind of with considering things like your environment and the patient and inanimate objects and extensions of the patient where you could potentially get bacteria onto the patient or onto yourself. And so the principles of infection control have to do with a lot about hand hygiene if you happen to be in a hospital or urgent care or office setting. And then there's about other items. So the hand hygiene is important because if you share an item with somebody and, you know, whether it's a keyboard, for example, or, you know, elevator doors or common doors, you really don't know who touched that before. And you can have germs or what they call fomites land on there and they could be potentially contaminated. You know, it might not just be COVID, something else. And so you have to be a little bit careful. And that really means kind of if you have access to some sort of portable soap or alcohol of some sort. And then lately, if you've heard more about kind of masks or for the general public, a variation of a mask, whether it's a scarf or a bandana. There's a lot of videos out there. You really don't need to spend any money these days and just kind of look up something that's very simple. And you really don't even know how to sew either. And so some of the principles are that different healthcare settings have employed have to do with protecting and knowing a little bit about how the coronavirus is spread. And it could be through droplet or contact. And so that's why the hand hygiene is so important, and also kind of covering the nose and the mouth. And then aside from there, some of the prevention means that if you have symptoms, just kind of the stay home cannot really be emphasized more, because if you kind of come in and you're infected, this is how you could unintentionally, of course, infect other people. And so these are some simple measures that are done. Some are a lot more preventive. You've seen depending on what setting you are, people are in personal protective equipment, and it kind of depends on what is being done, that sometimes the patient requires, for example, something that could potentially aerosolize their disease where it becomes airborne. And so then the healthcare worker would need to kind of have more precautions than normal. In the home setting, it's also a physical distance. So if one person is infected, you need to minimize the chances that the other people in the household don't become infected. And it really has to do with just kind of similar items, just kind of self-isolating if you're in a home. And it even has to do with if you have the benefit of your own bathroom. And if you don't, it's just about kind of bleach. And these are just some general principles, but they really apply to any setting.
No, thank you so much for reminding us that it's important to uphold all the principles. I remember when I was a research student during my master's, one of my colleagues, she used to religiously turn any doorknob that she would touch. She would get a tissue that she would have a bunch of tissues in her pocket and put it like on her hand and, you know, open the doorknob and close it. And I remember our colleagues were like, wow, she's just paranoid. But now it's so important to really try to uphold some of those additional hygiene principles so that we all try to stay safe. Now, I had a question for you, Trish. Patricia, are you still on with us? I had a question for you.
Yes, I am.
Great. So I want to pivot a little bit. You know, it is Young Adult Awareness Week, and I really like that we're keeping that awareness going and not forgetting that, just because young adults may be forgotten in the general population because they may not be at the highest risk. But young adults with cancer definitely are at an increased risk. And in a child's development, these kind of social measures of dropping school and not being able to have friends and seeing friends, it's critical for their development. What are you seeing when patients are calling you or parents are calling you about their kids, and what kind of resources are available to them?
So one of the things that we consistently heard from parents is, how do I talk to my child about this? What do I say? I don't want to frighten them, but yet I don't know how to explain that we can't go out to the playground, that you're not going to school. So number one, our social workers are certainly working with parents. You will find on our website a fact sheet, which was one of the first ones that we put out to help guide parents for how to talk about COVID-19 with their children. The other piece of this is coming back to young adults. Young adults are by nature very social. This isolation is challenging to them, and especially with the warning that individuals that are immune compromised have to be extremely careful. Young adults, as your organization knows, have a very strong social network. So it's extraordinarily important, and I listened to some of the program earlier today, to find a new way of being with one another, a new way to overcome social distancing, to be able to communicate and find support. And that's certainly something that Cancer Care provides each and every day.
Thank you so much for providing that information, which is extremely important for these young adults. And now I wanted to share something, and hope you can walk me through this diagram that someone shared with me recently, Dr. Hu. Let's see if this works. Can you all see my screen here? I hope you can see my screen. It's kind of over time, the different waves and where we are with dealing with this. Dr. Hu, could you comment on this diagram and where we are and what we should be keeping in mind?
Yeah, it's kind of a nice little diagram. I guess I'll kind of walk through it so we all have a sense of it. But it's the sort of the horizontal axis is over time, and this is what is kind of a model of what might be happening. So the kind of the first wave is you're starting to see all these COVID-19 patients, and some of them are just super, super sick, and they may be ending up in the ventilator. And as was previously discussed by some of the speakers, depending on the comorbidity, sometimes, there may be mortalities and even morbidity. So morbidity means you survive, but maybe you're kind of weak, deconditioned, and so it may take you time to get back to your own home. Maybe you go from the hospital to a rehab, and so forth. So that's the kind of the first wave. And then over time, hopefully, as researchers and those who are looking at clinical trials can kind of try to determine something that might work better, hopefully we'll see less mortality. The second wave, it says impact of resource restriction on urgent non-COVID conditions, right? So I suppose this might be on, so if you come in and you don't have the ventilators or something, then in the second wave, maybe some people aren't going to be able to get their procedures or operations for something which to the patient seems absolutely necessary. I want this tumor out like now, and then it says, let's see that the third wave is the impact of interrupted care on chronic conditions. Yeah, so, in the hospital, it's kind of like, sometimes we may be seeing COVID patients, but what happened to everybody else? And I would like to think that maybe it's because the outpatient practices are just doing an amazing job by stepping it up to see all the people who have chronic conditions and seeing them more frequently, whether it's through telemedicine and outpatients, but or in person. But part of me is a little bit afraid that the people who have chronic conditions are kind of maybe duking it out at home because they're a little bit scared to go into the emergency department or the hospital or urgent care or whatever setting. And so what could happen is that that they may be able to kind of duke it out a little bit at home, but then are they going to have kind of an exacerbation or a worsening of their underlying disease? So such as if you're a diabetic or you have heart disease, or kind of we're ignoring things, and then are you going to subsequently then be hospitalized? And that's kind of the third wave. Now the fourth wave is that regardless of your diagnosis, whether it's COVID-19 or you're a caregiver or somebody that you know, the fact is that many of us will know somebody, whether it's 1 or 2 degrees of freedom or just kind of your immediate family or friends. And that's felt to be kind of the psychosocial aspects of all of this. You know, the physical and social distancing, you know, let's be fair, if I didn't have my doctor job, I would be totally fine just kind of hanging out at home. And, you know, bottom line is if I don't go out, I'm not going to get it. But it's just not practical for people who don't have the means. They need to work, they need to care for their families. And so there is going to be an economic issues that we're already seeing with unemployment and so forth. And then the burnout that occurs to healthcare workers who there's these waves of people constantly coming in, and so I think that's the gist of this slide, which is kind of a great slide actually. So thanks for displaying it.
Yeah, not at all. I'm glad you were able to go through that with us, because when I saw it, I was like, oh, there's a lot going on there, and I didn't have a clear picture. It's kind of a static slide. It doesn't actually present where we are and where we're going. And so I'm glad you're able to go through that a little bit. Now, I just wanted to share another infographic that someone had sent me that I thought was really timely. And I'd like all the panelists, Patricia, Dr. Howe, and Dr. Boyke, to comment on, you know, where we started and where we can go. So this was the other infographic that I received. And I don't know if some of you have seen it. It's gaining popularity. It says, who do I want to be during COVID-19? And so there's different zones. You know, there's the fear zone, which is the initial panic that sets in. But then once you formulate a strategy, you hear from leaders or experts, you have community support, you may be able to be encouraged to step into the learning zone or the growth zone and do some of those other things to either find out more about the situation and learn from people rather than just reacting very quickly, or trying to tell people you appreciate them and being there for them in however small way you can. Whether that's being a hero on the front lines, whether that's being on the side, providing tools and resources, or whether that's behind the scenes, providing emotional support. And so Trish, I would like to turn it over to you to provide some experience that you might have with this infographic.
So I'll give you a relatively succinct answer. And that really relates back to my experience with being diagnosed with cancer out of the blue 10 days before I started as CEO at Cancer Care. And when people talk to me about, oh, I'm so sorry, etc., what I will say is being diagnosed with cancer made me a better executive and a better human being. And what I tell my board of trustees and my staff every day is that out of this, I want to be a better executive, a better leader, and I want Cancer Care to be stronger and a better organization as a result of what we've learned and what we've endured. That's how I live my life, and that's how I will lead the organization. Thank you.
Yeah, thank you. Dr. Boyke and Dr. Hu, could I get a comment, please?
Yeah, I mean, it's sort of an interesting slide as well. I have to say that I've known people at different gamuts, kind of even earlier on, because with this slide, it sort of makes you appear like everybody starts in the fear zone and learning zone and then growth zone and so forth. But, you know, I think it's a time more than ever for anyone. You know, I hear a lot about front lines, but honestly, everybody's on the front lines in some fashion, because there's so much to do that it's really all hands on deck, to be honest with you. And you never know what's going on with your neighbor or your family and friends. So it's just a sort of a reach out and not necessarily touch somebody, but kind of call them or, you know, some sort of video conference, because a simple phone call, and it's just the simple things these days that we do that are, can provide reassurance. And there are many ways that people can contribute, even if they don't per se take care of the actual COVID patients.
Yeah, thank you. Dr. Boyke, do you have anything further to add to that?
Yeah, I don't know about the fear zone. I have a healthy respect for coronavirus personally, but I don't know that I started there. Certainly the learning zone and growth is just going to be some of the changes that we experience going forward. As Dr. Hu mentioned about the front line, and I've heard comparisons to physicians as being on the front line. Certain specialties are on the front line way more than others. We're being restricted in our access to doing things in the hospital currently. But certainly if you're an emergency room doctor, an infectious disease doctor, an ICU doctor, or a hospitalist, you're on the front line. So I think everybody's in a little different place. The growth zone, I think, for a lot of us is trying to balance that to protect the patients from exposure, their exposure, while trying to individualize their treatments.
No, thank you so much, all of you, for providing some comments about that. I can tell you that I was definitely in the fear zone, not necessarily because I was afraid. I knew what the coronavirus was, and having a medical background, I could understand a little bit about it. But our workplace had no established policies, and so it was chaos. You know, cancer clinical trials are not necessarily essential. It just depends on how you define the treatment for the trial for the patient and whether anything else is available that's been clinically approved. But also I had been getting a lot of phone calls from people who were very concerned, saying, don't move out, don't do anything. And so initially it was like, well, I shouldn't breathe then either, right? No, that's not true. So, but I had such a welcoming community around me, including the AAPM and now Grit Health and all of you. And I found that this community really, even though I wasn't able to reach out and hug people or shake hands, I still felt very connected. And that encouragement from the community, local community, really kind of propelled me forward. And before I knew it, I really was getting into some of the other areas there. So thank you so much for commenting about that. Now, Dr. Hu, we had a couple of questions here in the audience about treatment and what it does. Now, if you remember, Dr. Mishra talked a little bit about some of the treatments that are coming out, including immune suppression, because they think it might be a cytokine storm. What are the, I guess, is it worrisome that we're trying to shut off the immune system when you need the immune system to be able to fight against an infection? And would you think that instead of having one agent that might be that breakthrough agent, that what we're going to find with our research is that we need to actually have a combination therapy for a targeted approach?
Yeah, I don't know if we know all the answers to that. So generally myself, I'm in the mindset of kind of less is more. But by the time you're in this kind of cytokine storm, the whole body is completely out of whack. And it's quite scary, really, if you're the patient or you're the provider, or the nurse or whatnot. But you can see somebody in the hospital and then seemingly hours later is just like completely different. And so there are ways to sort of kind of, I think the key to all of this will be, how do you prevent that cytokine storm from going so that you don't get super sick all of a sudden, and how you target or treat that is, I think, still to be determined based on a lot of clinical trials that are going out there. Some of the agents, I think, that were mentioned from the initial speaker, but they have to do with agents to prevent the cytokine storm from from propagating. And it has to do, for example, with inhibition of one of the factors like interleukin-6, for example, to kind of block that. I don't think that's the perfect solution, and that's why there are so many other entities out there investigating different therapies. And in the end, honestly, it's whatever works the fastest. And I think the key to at least what I've seen so far is to try to give these investigational agents much earlier before people decompensate, where it's very hard to turn off the storm, so to speak. And then that's where we might see some morbidity and mortality. So that's what we're trying to prevent.
No, thank you for that. We had another audience question. It said, and maybe I can turn it over to both Dr. Hu and Dr. Boyke. The question says, I've heard tamoxifen, a hormone suppression drug for those with breast cancer history or at a high risk for breast cancer, may also have antiviral properties similar to chloroquine, which is an anti-malarial drug that we're exploring right now. Is there any truth to this?
I don't know.
For myself, I haven't really heard of tamoxifen. Having said that, there are tons and tons of clinical trials going on, and I kind of haven't scrolled through all those pages, but I had not specifically heard about tamoxifen yet as an investigational agent.
No, actually, you're right. It's not currently an investigational agent in trials. I think the question was trying to get at whether cancer patients that might be using tamoxifen, whether they might be getting some side benefits if it has antiviral properties similar to some of the other investigational agents being explored, like chloroquine.
Oh, I see. No, I'm not familiar with that having any kind of effect then.
Thank you for that clarification. I do appreciate that. Now, I think we're coming to the close. We're pretty over time. We have really uncovered a lot with our time, and the panelists have really been amazing. And so I wanted to ask the panelists one important question that I keep coming back to. In this time, the cancer community, patient community, caregiver community, healthcare community, general public, we're all trying to practice distancing, whether that's social distancing, physical distancing, or medical distancing. How can we appropriately distance per guidelines, but yet maintain and prevent emotional distancing? Please do comment.
It seems like a Trish question to me. I think she seems to have all the resources for the survivors. I wish I could utilize all of those. I think that's complex. I don't know. There's a lot of video conferencing these days, so it could be trying to do some support groups and more check-ins than normal because people feel they're just not in touch anymore. It's very, there's a phrase I use whenever, in the hospital, we put people in kind of contact isolation before all this all the time. And I always tell the residents it's isolating to be isolating. It's isolating to be isolated, and even more now. And we just have to work out different ways to be in touch more often. And I think a cancer standpoint, it would be helpful to have support groups, whether it's virtual or not.
I agree, and it's been interesting today in the last two webinars to hear how great the support groups are, and I hate to almost call them support groups because they're their own primary service, whether that's Trish's organization or psychological support. I see that lots of patients are spending more time FaceTiming their children, FaceTiming their grandchildren, and it's obviously very difficult to try to help figure out emotionally what to do other than to say, I always start out saying we're all listening to the same news. We know the reasons why we're doing these things. I don't know if that helps people at all, but it is something to consider in addition to medical care.
No, absolutely. Those were great points. And looking at the previous two sessions before this one, and I was listening in, they were great sessions. In the first session, they went back and forth about what it means to have an awareness week and what it means to share stories and what it means to resonate and connect with those stories, even if they're stupid stories. They don't have to be powerful stories. And so I thought that was a really interesting way to stay connected. In the second session, I heard about how we can become aware of our emotions and how we can refine that and really try to move forward, and how sharing of these stories can kind of feed into helping us better understand our emotional states so that we can respond appropriately as well. Now, building off of that even further, as we've talked, there are different ways of connecting here. You know, there's ways of connecting through Zoom, and there's ways of connecting through the phone. You can go old school and write letters if you want to, or you can, you know, write emails. I know that our group, our colleagues, we have Thursday happy hours that we've organized to kind of just stay together. We've done a bake-along that I've organized where one person had a recipe about how to bake scones, and I made the worst looking scones, but they tasted pretty good, I swear. So there are different ways to stay connected, and I think we should continue that. We should continue building on that community. And I wanted to really thank all of you, all the audience members. I really apologize that we went over time, but we had so much great information that I just didn't want to cut it off abruptly, because I really do believe this is valuable information for all of you. I want to give a strong message to all of you here today. How we respond over the coming months will be the ultimate test of our leadership and who we are as people. History will judge us on whether our actions were effective, not whether our actions were noble. Only results matter. To save the people and world we love, we must fight this fire with everything we've got. But you are not alone. Please join me and take my hand virtually, and let's all get through this together. I really do encourage you as patients, as caregivers, as professionals. If you need that support, there's so many support groups out there, including Grit Health, including some of the cancer advocacy foundations. Please do reach out, build and improve upon your support groups. Put the word out there about how we're continuing these conversations. Next Saturday, we're going to have a huge conference where there's going to be so many important sessions from experts that will build upon what we're doing, especially for the cancer community, because there's not a lot of information out there yet. And so we're really forging ahead and paving the way to provide that information and provide you access to experts who have really donated their time. And so Patricia, Dr. Hu, Dr. Boyke, Dr. Mishra, I really want to thank you for giving all of your time today for this panel and for all the attendees. Attendees, I really want to thank you for attending. And with that, I'll turn it over back to you, Dave. If you could close out for us, that would be wonderful. Thank you.
Thank you, Arun, and thank you, everyone. These conversations were some of the most real that I've been a part of in my life. And if we take anything from how challenging this time is, I think it's how much we're showing up with real humanity and real concern for each other. And so for everybody who shared their expertise and also how real and human they are, thank you for the audience, for our panelists, for all of our teams. Grateful to spend this time with you, and I hope you get to enjoy a holiday weekend with your families. Thank you, everyone.